Okay. I guess we're live and it didn't play. Okay, never mind. All right. Let me do this. Okay, let me do this. Okay, I got it now. All right. Let me just watch for Mohammed when he comes on. Hello, everyone, and welcome back to my channel. Today, we're going to have a discussion on Down syndrome. So yesterday was Down syndrome month. So now we want to, just talk more about Down syndrome. We have our specialist here. We have, let me go here, Dr. Ahmed, who is a specialist in many things, um, and in a special education, behavioral analysis, and psychology, right? And then we have Dr. Sonia, who is a psychiatrist. Um, we have, let me see, Miss Afiqa, and she is a developmental psychologist. We have Miss Sheila, who is a family counselor, right? And then we have
Dr. Kausar,
Isra.
I
Yeah.
have suggestion. If everyone close or mute his mic until he come to speak, because I hear some voice.
Okay. All right. Yeah. Good idea.
Please, everyone, please mute his mic.
Except for me. Okay. Then we have Miss Isra, and she's a behavioral specialist. And I think that's all. Okay. So we will start. Okay. If you, please, this is a discussion. So just come in wherever you feel that you want to come in. Okay. Uh,
Okay.
Everybody, please participate in the discussion. Okay. Okay, the first part is we're going to discuss is early development and intervention. So, how does early intervention impact long-term development of children with Down syndrome? Okay, so first we have motor skills
Dr.
development.
Kausar,
Um,
the voice is coming
yeah,
with noisy sound because not everyone mute his mic.
I think that's from my AC.
Oh la la. Okay.
Doc, your voice
Yeah,
is echoing actually. I think you have to lower down the volume of
do you want me to lower the volume? Okay,
yeah.
wait, hold on. How's that?
I think it's fine.
Okay. Okay. First, we have the motor skills development. So, early physiotherapy helps improve muscle strength, balance, coordination, allowing children to develop essential skills like sitting tolerance, crawling, walking, and fine motor skills. Um, then we have a speech and language development. Early speech therapy supports oral motor skills, articulation, expressive and receptive language, and improves in communication, reducing frustration. Cognitive development, early intervention programs focus on problem solving, memory, and attention skills, using structured learning approaches that cater to the child's individual learning style. Guided interactions with peers and caregivers or grandparents help children develop emotional regulation, turn taking, and social and communication skills, fostering confidence. So, who wants to add to this?
Um, I think probably I'm gonna add on this part a little bit because most of the time this is going to be my focus in my field. So please allow me to share.
Okay.
Okay. Okay. So when about early intervention, especially children with special needs. Okay. the things that we highlighted in the developmental stage, which is the four things that you can see. The first one is the motor skills, and then we have speech and language, and then we have cognitive development and also social and emotional development. So I guess we are going through like maybe one by one. I wouldn't say it's going to be very specific, but I hope it can touch like every each important aspects in the children development. So the first thing first, usually in the intervention, we a lot of us focus more on motor skills because it is one of the early developmental stages that actually experienced by the children. Okay, so for motor skills, we have gross motor skills, and then also we have fine motor skills. So I think generally all of us know that usually for children with syndrome Down, they are going to experience a little bit, we call it muscle weakness, muscle weaknesses compared to other typical developing children. Okay, so for us, early intervention, physical therapy is like very, very important because somehow it's going to promote their development of gross motor and also fine motor as well. So it strengthens the muscle strength, okay, it improves the body posture, and also it promotes the balancings, which is all of these skills we are going to actually use it in our daily life later on, especially when we send the children with Down syndrome to schools, so they are able to survive without like fully support from the adults. Okay, so that one is going to be more on motor skills. And then when it comes to speech and language, which is I think one of the most important things because actually there are a lot of important things to touch. So for speech and language, from my experience, most of the children with Down syndrome, they have the initiative to communicate. It's just that the way the verbal expression can be limited to what ability that they have only. So why speech and language therapy is actually very important because they can promote a better to strengthen their oral motor skills. Okay, it can promote their hearing abilities, their articulation of words, and then also promote the processing, the ability to process verbal info. Okay, so when it comes to speech and also language, yes, from our part, we are going to try from the therapist part, we are going to try our really best, okay, to help the children to communicate. However, there are circumstances that the child cannot go for it. So that's why we introduce the alternative approach, which is it can be in terms of visual aids, visual support, and then we have sign language. This is kind of quite famous among the special needs children, which is having a Down syndrome diagnosis. And then also they can also use we call it AAC, which is another form, another apps that we use for daily communication purposes. Okay, so why speech and language is very important? Because one of the foundation that promotes to social and emotional skills later is going to come from speech and language as well. Okay, so it helps to prevent any unwanted behavioral issues and also frustration, because usually these things happen a lot because of there will be miscommunication. Whatever we are trying to deliver to the children is not really received well by them because they don't have the capacity to understand. So that's why we really hope that children with Down syndrome actually get support from the speech and language therapy as well.
Yeah, yeah.
Okay.
I have a question here, please, for you,
Yes.
doctor. اوكي يعني
I'm not a doctor yet. I'm not a
sorry.
doctor yet.
Okay, speech therapy. There is a question. يعني when I'm trying to work with Down syndrome, I find around 50 of them can't speak. So we can work with them by PICS program or not?
Sorry, can you repeat your
Yeah,
questions
okay.
again?
There is non-verbal Down syndrome. يعني they can't speak, they
Okay.
can't try to communication to make communication with me. I can work with them by PICS program or not?
PECS program.
PICS. Oh, the PACS
Yeah.
program. Oh, okay. So, from my part, from my point of view, I would say yes, as long as they understand how the PACS program's working.
Mm.
So, PACS program, briefly, we can see that it's kind of quite simple, okay, because it's just like you provide the visual image, and as long as they know how to construct a sentence on what they want from us, for
Mm.
example. But then, when involved in the process of teaching or using the packs with the children, it's actually going to take some time for them to understand how it works, because communicate with the pack using the PACS system is not same with the our verbal communication. Is going to take some time for us to understand, and then before we use PACS also, we really have to ensure that the children have what we call this one enough nouns, knowledge on the verbs, the pronouns, and all that things. So all the knowledge will be helping in terms of using PACS in daily life. But it is actually possible.
Okay, thank you.
Yeah, I've
Okay, you're
used
welcome.
PECS with kids with Down syndrome, but I find that the AAC of devices seem to work a lot better. And if you
Mm.
look at it for nonverbal kids, um, Down syndrome or autism, whatever the case may be, this is their voice. So, it's kind of hard for them to carry around a big PEX notebook. Whereas the
Mm.
AAC device, it makes it much easier. And I find they learn quicker on the AAC device than they do with the physical PEX cards.
Mm. Yes, yes, yes. I would say the system is very compatible, and it is easier. Like the resources is unlimited compared to packs. We have to like prepare every single thing, and then although we prepare hundreds of pictures, there might be a situation that all the pictures doesn't actually suit whatever the children needs. Probably they need something else, which is I think AAC can be another resource that is more approachable instead of using packs.
Yeah. Anybody else want to add anything?
No, I
Everybody's
have a
quiet.
question. I have other question also, but to Dr. Sonia. يعني before delivered, we can protect the child to come a Down syndrome. Like when the mother is pregnant, there is anything we can find this boy will coming with a Down syndrome to protect it or not?
You mean to
Uh,
prevent
mm,
it?
Yes.
yeah, mm, I think not to prevent. Yeah, to prevent maybe we can see that from because this is a genetic problem. So maybe to prevent it, maybe we can assess uh from father side or mother side if there is uh anyone in the father side or mother side that has Down syndrome. But if already like the mother already pregnant, we couldn't do anything. Maybe we can detect early, but how can we prevent? We cannot prevent anymore because Allah already gave the baby to the mother and the father like that. I think that is my opinion.
Yeah.
Thank
The
you.
only way that we can actually, yeah, you're right. The only way that we can actually see that there might be a link or something is through the genetic testing. And in most cases, Down syndrome isn't hereditary. There are some cases where it is hereditary, but I think it's like 80% of cases are not hereditary.
Yes, because it's a genetic, and it can be, shown during the pregnancy or even before pregnancy if they are, you know, doing tests and prenatal tests and whatever. So what it can be is taking measures to address this issue if it is the mother or the parents to continue the pregnancy, and then they make counter procedures, just like developmental programs from birth actually, and they do it to counter the yeah, the genetic, the once the child is born, then we have to take measures and do all the programs and work on all the delays and defeats. This is what is being addressed now,
Yeah,
because
right.
yeah, not like ASD children where we can't know which genetic and which is what's gonna be. But Down syndrome, this is why it's actually now so advanced, because we address the issue since pregnancy and since birth. I
We
think.
lost Ahmed.
Doc, can I butt in?
Yeah.
Okay, through advanced technology, they have developed this what we call genetic engineering, right? I do
Hmm.
not know, yeah. And we cannot actually prevent it, but we can detect it early,
Right.
right? Okay, so yeah, like I do not know what part of country is that they are using genetic engineering, and then if they
Probably
found
US.
in the US, right? Yes, yes. Thank you for
Mm.
letting me. So if they found out that there is possibility that the child will develop
Yes.
Down syndrome, marriage counselor will take over if they want the kid or they have to do therapeutic abortion, something like
Yeah.
that. Mhm.
Yeah,
Yeah.
yeah, this is what I'm talking about. It's about protocols, how to,
Mhm.
yeah. So now they are doing, it's nothing like any other, defects or any others issues. Now it's not like ESD children, we don't know the genetic yet, because it is a genetically, shown. We can address it since birth, and it has been a lot of um, programs that address the issue since birth. So it is what we can do. And
Yeah.
it is what helps it, get this, really upstart and this booming and developmental booming, I'm saying, because now we have them lawyers, we have them, hostess, and we have them athletics in every, they are really emerging in the society very good.
Yeah.
And if I may add,
Yes.
doctor,
Yes.
if I may
Yeah.
add, since we cannot prevent it, once it is detected already, I guess the first step that we have to take into consideration is the preparation of the parents for the acceptance.
Yes.
Right.
Sure.
Because in
Yeah.
100%.
any conditions of the child, if there is no acceptance of the parents and there's no clear explanation of to the parents of what's
Yeah,
gonna be
sure.
expected once the baby is out, or even while the child is still in the womb of the mother, they would be
Yeah.
lost. So it
Yeah.
is very important that we prepare the parents for what's going to happen and what is happening during the pregnancy. That way, the parents would have a better um, acceptance and mindset on how to accept the situation as it is and accept the reality that will happen once the child is delivered into the world, and what are the possible therapies and other interventions that will be necessary for the child. Because for in my case, when I work with families, it is really important for parents to have that acceptance of the
Yeah,
condition
yeah.
of the child.
I think all of
Thank
us
you.
here have worked with parents that were not willing to accept a diagnosis.
Yeah.
Down syndrome is more obvious, but then when you have kids with autism, for example, a lot of parents do not want to accept the diagnosis of a child that they have a child with autism or Down syndrome or whatever it may be. I think everybody here has worked with those parents that are unaccepting of diagnosis.
Sure.
Exactly.
Yeah.
Okay, let's go to the next one. Okay, hold on. Let me fix this. Okay, let me see. Where are we? We should be.
Shall
Oh,
I
hold on.
continue a little bit
Okay.
more?
Yeah, it is. Let me see. Okay, what are the key developmental delays seen in children with Down syndrome, and how can they be addressed? So, children with Down syndrome often experience delays in speech and language. Many children have difficulty forming words due to low muscle tone in the mouth and delayed cognitive processing in speech therapy. Sign language and communication devices can help, which we just talked about. Low muscle tone affects crawling, walking, and fine motor skills. Physiotherapy and structured play-based activities improve coordination and strength. We should have had Joni on here for physiotherapy. Cognitive skills, delays in memory, problem solving, and attention require specialized teaching methods, including visual aids, repetition, and hands-on learning. Social emotional development, some children struggle with impulse control and social interactions requiring structured social development. So let's see, who wants to go into this one more?
Maybe I can add, I can explain more in this area. Uh, since Down syndrome affects multiple areas of developmental, like Dr. Carter has mentioned, motor skill, speech, and language, and then cognitive skills and social emotional development. So starting therapy early will maximize the child's potential. And then similarities with therapy also is very essential because the children with Down syndrome has weak oral muscles and frequent hearing infection. So it's challenge for the speech progress. And in cognitive development, these children benefit from structured learning experience. Like before, we have discussed that using visual aids and maybe by repetition and hands-on activities, it will make them progress more in academically. Early socialization also is crucial for them, maybe through play groups, structure interaction that teach the children how about the social emotional skills, like uh, turn taking, recognizing emotion of others, and responding appropriately with social cues. So we don't forget also about health outcomes we need also to address the health because these children often experience secondary issue such as obesity, poor posture, and coordination difficulties. So early intervention is very important, especially if we do it before age of 3, that they might have a greatest impact on learning and development time. That is what I can add.
Yeah, I mean, all of these therapies, they're really important to get them early. I mean, I've had parents that come in, and Dr. Sonia has had parents that come in that the child is sometimes 10, 11, 12, even we had one 14 that never had any therapies. And then the parents, they expect a miracle when they haven't put forth the effort to make sure that the child gets these early interventions. These are critical. These are very critical, especially, when they're young. Say for infants, infants need physiotherapy. If they're not doing anything else, at least the infants with Down syndrome need to have the physical therapy to build up their muscle tone. When they're, say, 6 months old, or they can start the other therapies. Especially when they start babbling and stuff, we can work on the low muscle tone in the face and the fine motor skills. But these are imperative. These are very imperative. And then you have those parents that do not realize the value of these early therapies. They're extremely, extremely important. So this is one thing that we need to relay to the parents, how important these are. Some of the parents just, aren't, you know, they just don't understand that these therapies are important from birth, especially with kids with Down syndrome. That they think, okay, when they're 3 years old, when they're 5 years old, when they're 7 years old, they can start the therapies. But the therapies early on are really critical.
And if I may add, doctor, aside from emphasizing the importance of early intervention, we also have, once the child is on therapy, it is also imperative that we emphasize to the family the importance of home therapy,
Yes,
because the
yes,
therapy we do in the clinics or in the therapy center is just 1 hour 2 hours, but it is
yes.
many hours with the child, with the parents. And if the parents will be doing the same therapy, there's continuity of therapy in the home, then there's faster progress of the children or the child. And this is also very important when it comes to what Dr. Sondang said about teaching on the structure, because when like for example in language, to be able to help the child manage their behavior, we have to uh, teach the parents to have clear behavioral expectations, because since
Hmm.
the child with Down syndrome has a steady vocabulary acquisition, so it's easier for them to have that structure of rules, of structure of the limitations and scope of what the child can do. That way the child will also help it will also help in the critical thinking of the child as they progress with the therapy.
Yeah. Yeah, home therapy is really important. I know for myself, I send things home, activities home for the parents to do with the children at home. So do the other therapists that I work with. And I know at the center, they're doing the same thing. But sometimes we find that we can tell that the materials we sent home are still have not been used, but we try to get the parents to understand that this is something that is important, that they also one hand can't clap. We always use this term,
Yeah,
one
yeah,
hand can't clap.
Yeah, that's
sure,
true.
It takes two.
sure.
It takes
Yeah,
them doing what we want them to do at home, and at the same time we work with them at the center.
Mm.
trying to pull us together so the child makes good improvement. We have some really good parents that really work with their kids, and we can really tell the difference in those
Yeah,
kids and then
yeah,
kids that the parents aren't really doing much.
yeah, yeah. So I can add something that is when we are working with a home program, it is essential to make the parents, we train them on how to. Some
Yeah.
parents, most of them, don't know how to address this issue or don't know how to handle,
Hmm.
whatever
Yeah, we
delays
usually
with their
instruct them
children.
and
Yeah,
train them and
yeah.
tell
So
them.
it is
Yeah.
important that we give them a small program on how to address the issue and also include them in the program in
Mm.
order to work with their children and do the same procedures and do the same steps, and then it really helps with the time that we are taking with the program. We can do so much and achieve so much in so many time in so little times because of the program and including them and training them also. It is
Okay.
important.
Randolph, did you want to say something?
Yeah, I want to add on the doc. Actually, that is why it is so called a collaborative effort between the center and the home. And
Yes.
that is actually our struggle right now because
Yeah.
we are doing intervention at the clinic or in the rehabilitation, but at home there is no follow up.
Yes.
As much as we
Right,
love
right,
to
right.
give more, but there are also parents who don't have really time to have
Yeah.
follow up with their kids.
Yes.
Yeah. So actually, that is
Yeah.
one of the
Yeah.
challenges of
Yeah,
this.
it's a real struggle, if you have, like non-compliant parents
Exactly, exactly.
and they don't really, but most of them, when I address this issue, I see
Mm-hmm.
them, most of them, doesn't really know how to work, and they have this
Well, I
misconception that it's not gonna be done. It is, they have this misconception that it is difficult. So a
Mm-hmm.
part of the training, we have to work on training so much because as we ABA therapists say can't stress enough on NET and natural setting, because natural teaching is what the parents do in their home, and you have like 4 to 8 hours with the student, but he lives with his parents and goes back to his natural setting, and maybe you have like 50 trials with them, but with the parents you have more than 500 trials with them.
Agree on
So
that.
yeah, so it is, most of the, it works in awareness and how you train them and how you prepare them for it, because misconceptions and misguidance can be really hard for them.
Yeah. And one of those, it also helps like thanks to the technology, we have cell phones now. We can
Yes.
communicate directly to the parents.
Yeah, yeah, yeah. Actually, remote supervision helps a lot,
Mhm.
and it can be done live during the day. I've actually seen
Exactly.
this. Yeah, and people are doing it all over the world. You can take supervision from any country, actually, basically, and they can be with you all the day and guide you through it. Yeah.
yeah.
And if I
Um,
may add, oh, sorry. Yes,
go
Doc.
ahead. Go ahead,
Okay, if
Sheila.
I may add, some of the parents, the concerns when it comes to home therapy is their reason is they don't have the materials they need for the therapy in the home. So I always emphasize to them that like fine motor skills, you can use available things at home, like the cup, the utensils, and everything, or even their toys, just for them to practice the right way of grasping, for example. So it's also imperative that uh, they be aware that even the things at home, even the chores at home, is also a therapy that can be done by the child. Even just the sorting of the clothes, it's there are
Yeah,
alternative ways on which we can do the physical therapy or the occupational therapy in the home.
yeah,
And
yeah,
once
sure.
this is explained to the parents, they got the idea. It's better for them, as Ms. Ezra emphasized, if it will be just communicated the right way, that all their clarifications can be answered, then the home therapy would be, I think, the parents would be more open because they become more open when they understand that, so I can do that. So that's a
Yeah,
therapy also.
yeah,
They
yeah,
have aha moments at times.
yeah, yeah, 100%.
Exactly.
Yeah,
Actually, we had one scenario happen just recently. It's that parents are so busy in their works, in their jobs, and then most likely their kids are taken care of only by nannies.
yeah, yeah,
And then parents, like how many months their kids with us, I mean her kids with us. The parent or the mother herself was asking for what's the progress, why there is no progress with my daughter, like this and like that. And they said, Mom, all the notebooks, all the materials we put all inside the bag of your daughter. But when the bag brings back to the school, nothing happened. Even how we arrange it, the materials inside, the same when we open it. That's actually, well, it's a very challenging part, but
Yeah, we also get
let's try
people
to
that,
encourage more the
you,
parents.
you know,
yeah,
sometimes when this, if they are willingly to pay for a shadow or pay for a certain, specialist that can be with the child, most of the time at home, it is about the home actually and the home setting. This is where I want him to get his whatever I'm teaching him in the natural setting. So it's about the home. If the parents is not doesn't have time or is not willingly to use up what I told him, then I offer, something, someone special come help for this gap of time that he is spending at home. And then
Yeah,
we, get rid of the, yeah.
I agree with that point that we have to make an early awareness for this problem. That some parents don't even know that they actually need a service. They need a shadow teacher for their child. They need someone who actually understands their child, and we have to give them the awareness of the problems that their child faces. Early intervention actually is very helpful in this point because the early we are interventing in the problem, the early we are going uh, to make a difference to to make it to to help the child more. That, that is
Yeah, yeah, definitely.
yeah.
Yeah, we can't
Uh,
emphasize enough on early intervention because it really, make sure that our program is doing good and we reach development very soon and very, come by far. That
in
is,
different ways
big
actually.
part. Yeah.
Well, another thing I see that the parents need to understand that early intervention and therapies is not an overnight miracle. I mean,
No,
we've
it's not.
had parents that come in, say, after 1 or 2 sessions of speech for a nonverbal child saying, are they speaking yet? No, they're not speaking yet. You
I
know,
see this
so,
a globally thing.
so,
Yeah.
so they also need
After one session.
to understand that
Yeah,
these
yeah, yeah.
interventions take time. They're not a magic wand. We don't have
No,
a
no,
magic
no,
wand.
sadly, no.
Exactly.
Yeah,
Yeah.
yeah.
Okay.
This
Let's
is
go on to
why,
the
yeah, this is why it is about awareness. You know, parent awareness. You
yeah.
have to make sure that they don't really actually. Well, it is not a magic wand. It takes time and takes effort, and it takes all of us. Yeah, a big team and a big
Yeah.
problem, and it is a a
It's a team.
lifelong
It's a
process.
team.
Yeah, yeah.
It's a
Yes,
teamwork.
it's
Yeah.
a
It's
team.
a collaborative effort.
Okay, let's go to the next one. Let me get here. Okay. How can parents and caregivers prepare their children for structure learning? So, parents play a key role in preparing children for formal education by establishing daily routines. And I think this is like really, really important. This helps children develop predictability and structure. Encouraging communication using gestures, visual schedules, and communication boards to build expressive and receptive language skills. Promoting independence, teaching self care skills like dressing and feeding boost confidence.
Yeah.
Provide opportunities for social interactions. Enrolling children in play groups or therapy sessions that can help them learn social norms and building friendships. Okay, let me go back here. Okay, so who wants to build on this?
I could go on this one.
Okay,
So,
go ahead.
establishing daily routines is very important. So we are filling their time. We are making like a schedule for their day. We are putting up uh, a very organized program for their day. At first, when they wake up at 7 a.m., they are going to go bath and brush their teeth and to the end of the day. So establishing a daily routine, filling their time, organizing their time, and we have also in the middle of it some joy. They are going to the playground. They are going um, to be with the other, to socially interaction with the people. They are going to uh, they are going to uh, prepare their experience and go through it, encouraging communication that uh, their nature is they are socially seeking to interact with the other people. They want to be they want to interact with the people. They are seeking for it. They are socially their social interaction is very strong one. Uh, through my experience with dealing
Yeah,
uh,
I mean,
well,
um,
with
I
children, yes.
okay, go ahead. Go ahead.
Okay. Through my experience with dealing with syndrome, with Down syndrome children, they are socially very strong. They are seeking for it, and promoting independence. They want to be like I can do it. I'm going to throw it. Once they know. Direct direct skill that they need in their life. They just go in. I want to go in independently, and we are seeing in the movies and the other in the other things or like videos we are seeing them uh, like they are interact, they have jobs. So why don't we do that in our developmental country? Like,
Yeah. Well, um, the daily living skills and things like that is really important. Teaching kids routines, um, giving them some basic academic tasks. Start teaching
yes,
them
yes,
maybe to write the alphabet, learning colors, learning numbers, and things like this. This is also something that is important for them to the parents to start doing early on.
Yes, and if I may add, um, some of the things or techniques that I teach parents is that make it a fun activity, especially when you're doing it with your child. Like, for example, you're teaching your child to color. Do the activity with your child. You also color with your child because that way it does not become as a responsibility. You don't see it in the perspective of responsibility, but it comes from a perspective of, I want to be involved with my child. I want to get to know my child. So it's more of getting to know your child and spending quality time with the child, because once the relationship between the child and the parent becomes strong, that bond helps also in the progress of the child. Why? Because the child mimics what he sees in the child, in the parents. When the child sees that the parents are having fun or enjoying the activity doing with them, they are more empowered and motivated to do more activities with their parents, and vice versa. They both they both get something from it.
Yeah, modeling is very
Motivation,
important.
the motivation grows and grows, and this builds up the progress of both the parents and the child. The child
Yeah,
on the part of the progress in their skills and the things they need to improve on, and the parents having that journey, appreciating that it is a journey with their child, not a responsibility that is very heavy on the shoulder.
yeah, yeah, it's a journey, exactly, 100%. Okay, let me go to the next one. All right. Let me see. Okay, now we're going on to educational and learning support. Okay, why are children with Down syndrome typically placed in special rehabilitation centers than mainstream schools in the Arab world and in Asia? Okay, these are the most of the reasons that I found. First, there's the belief that children with Down syndrome cannot learn at the same level as their peers. Many schools assume that all children with Down syndrome have severe intellectual disabilities and are unable to follow a mainstream curriculum. Lack of trained teachers and support staff. Many mainstream schools do not have educators trained in special education strategies or classroom assistants to provide individual support. Absence of inclusive education policies. Many countries in the Middle East and Asia do not have legal mandates requiring mainstream schools to accommodate children with disabilities, leading to automatic placement in special education centers. Parents and social perceptions. Some families and communities believe that children with Down syndrome will struggle socially and academically in mainstream settings, reinforcing the preference for special education centers. Limited classroom accommodations and accessibility. Mainstream schools often lack adapted curriculum, assistive technology, and modifications such as visual supports, extra time for tasks, or sensory friendly environments needed for inclusive learning. Okay, who wants to add to that? I actually have a lot to say about that. Who wants to add to that first?
Yeah, we all do. We all do. We all been there, and I've been in school system where they won't accept Down syndrome because of the,
The face.
facial features. Yeah, yeah, yeah. Which is kind of, like, okay, if it is,
Discrimination.
yeah, yeah, it is. It is physical discrimination, which is actually very prejudiced to what they can achieve in school systems, since they are so different from so many, children with ASD or whatever, because they are socially, you know, very, high in social interaction, and very can do really well in group sessions and group environment, which is what school really is. It is
Hmm.
about group, setting and group interaction and social interaction. Yeah, and they can, I always say that it is the difference between ASD and Down is the social interaction and the social, because since they are so, advanced socially, they can, develop so many before ESD. And this is why Down syndrome now, where it is, they can reach so many levels now. They are in schools, they are in, universities, they are
Yeah.
holding jobs. Yeah, and this is why because of the socially, advancing, because they can do modeling, they can they really learn so much with modeling and peers, whatever interaction with them. And when you treat them like this, and you have policies like this for school that is denying them of their rights just because of
Right.
the facial features and physical features, since then you are doing them so wrong, because you are denying them of their rights to learn
Yeah.
and thrive.
Yes, I
Yeah.
agree with
Well,
it.
and in the United States recently, there was a girl that graduated the university and passed the bar exam to become
Yeah,
a
yeah,
lawyer.
yes,
You know,
yes.
there's also, I know of another one that she, got her degree to teach early education, kindergarten first to kindergarten through third grade.
Yeah.
So,
Yeah, I see
and
the
she,
Australian airlines now are using Down
oh yeah,
syndrome
yeah,
flight
I saw that one
attendant.
too.
Yeah,
Yeah, I
yeah.
saw
So
that one
it
too.
is going everywhere. Since we are make sure that we are including them in schools and then in real life, not just, by laws that doesn't
Just not just
apply.
by only their face. We have
Yeah,
to do
yeah,
a assessment to see where they are. What is their IQ? What is their level? I have
yeah,
done many IQ tests for Down syndrome, and I have
yeah,
found a lot of them that their IQ, well, I won't say a whole lot, but their IQ was normal. I've had a few that their IQ was at the normal range, and
yeah,
I've had some that were slightly below normal. Yeah, I've had those kids that had like 50, 45, IQ, that are they are extremely disabled. But then we have to look at the ones that do have the normal IQ, or do have the IQ that is
yeah, yeah.
just a little bit below normal. Those
Yeah,
kids
below
could go
normal,
on
but
to
there are
mainstream
so
school.
many things that they can learn. You can work with, crafts and doing, whatever they are drawing, they are making, so many things. It's not about just learning reading and writing. It's about,
Yeah.
making them, yeah, actually doing so much. And they are a great athletics, even when you are, in the Olympics, Special Olympics, and you watch it, and
Yes,
you
Paralympic.
see them come so far in achieving medals and, you know, athletic achievements.
So the
We
issue,
actually have a journal. Yeah,
sorry, go ahead.
um, we actually have a journalist called Rahma Khalid. She is Down
Yeah.
syndrome and she is a journalist in the Egyptian
Yes,
TV.
yes, yes, yes,
Rahma Khalid Hussein.
yes, yes,
Yeah.
Yeah,
She
I
Actually,
is
the
a
feel,
issue.
journalist with Down syndrome.
yeah,
yes,
I
So
yes,
yeah,
yeah. So
there's so many
actually,
there.
the issue is not the child's inability to develop something, right? But maybe the issue is the unwillingness of
Yeah.
the school to
Yeah.
adapt
Mhm.
the teaching technique for
Exactly.
these children with Down syndrome. So maybe they have lacked uh, essential accommodation that needed to make them learn better,
Yes.
right? So it is
yes,
not the issue of the inability, but because of they are not ready yet to accommodate them.
Exactly. That's
I
yes,
what I
think
Yeah,
that
also
that's
is the
see.
also true.
Yes.
The society,
mm,
you know,
Yeah.
the
yes,
society and the discrimination. There's a
Mhm.
lot of that. I won't just say in the Middle East and Asia, and
Mhm.
throughout the world there is this. But, like in the United States, there is the IDEA Act, which that protects children that have, or not just to children, anybody that has any kind of disability. So they have the right to go to regular schools and to be in regular classrooms, depending on their level of disability. Some of them have to be in special education classrooms, and some of them are able to be into mainstream classrooms. So it would just, depend on the disability and the level of disability in the universities and the colleges in the United States, for example. They have special education resources there, which, I'm not sure about here if I've even seen them,
Mhm.
these kinds of resources here.
Yeah,
yeah,
exactly. So we had one experience, Doc, no? One parent of mine, like they went to a certain school because they want to put their child in a mainstream program. However, when they reached, the principal herself was directly telling to their face that they cannot accept their daughter because their daughter is not normal.
Yeah, you get
yeah,
you get
So
yeah,
this. Yeah.
that's what I can see the
yeah,
problem right now. It's not all about the disability or the inability of the child to cope up or to thrive in the regular setup,
yeah,
but it is the acceptance. They are not yet ready to have these kids in the regular program, school program.
Yeah, yeah, yeah. This is, I think, one of the main issues. But now here in Oman, I think the ministry is setting up, rules and regulations, Ministry of Education, for them to accept kids with disabilities if they are able to cope in the mainstream classroom.
Mhm.
So parents should start to, if the schools aren't cooperating or something, they should go to the ministry and say, look, my child, they can do this. They are at their right educational level, but, we have the school. Do you guys remember Salim? There was that boy, Salim, that was with us years ago. And he had an intellectual disability, but his mother had fought with the ministry to get him into a mainstream school. And she succeeded in getting him into a mainstream school.
But I just hope
Uh,
that it we will not reach that far. Like you have to fight for the right of your child.
Yes, you
Yeah,
have to
man.
yeah,
fight for the right
yeah,
for your child, you
yes,
Mhm.
know?
I would
definitely.
like
That
to
you
add
have to
something
go to
about
the
this, like,
ministry and
Yeah,
no, my son is like
which
this and
is
like that. Yeah.
Yeah, it's a much struggle
Yes.
because it's a life struggle when you
Yeah,
have your child and you see them develop, and the society actually it's what's holding them back and
Mm-hmm.
denying
yeah.
them the right to be as normal as it can be.
Yeah, but who is going to be the child's biggest advocate? That is going to be the parents. So they have
Yes,
to fight
Parents.
for their child's rights. A
yeah,
lot of kids don't get the rights that they deserve because the parents, don't follow the line and to fight for their kids. And they really need to. They need to fight for the right of their child to get the education that the child deserves. If it's in a special education center where the child has too much of an intellectual disability that they need to go to a special education center, okay. But then if the child has a regular IQ and that doesn't have a intellectual disability, why are they in a special education center? Only because of this?
Mm-hmm. Yeah.
mm,
You know? That's not fair to the child, that's not fair for the parents. But the
Mm-hmm.
parents have to fight for their child's right.
yeah,
And
definitely.
I guess
Professor,
on that note, oh sorry. Go ahead.
it's okay. You can say.
Okay. On that note, doctor, parents need to be aware of what are the rights of their children,
Right.
because sometimes even
Exactly.
the parents do not know what are the rights of their children and what are their rights as parents, because they just follow what the society dictates.
Yeah,
And especially in other areas where the parents themselves have, let's say, lower education, they're not also educated, the more that they are not empowered to fight for their kids.
yeah,
So these are some of the system downfall when there is no awareness, when there's no raised awareness for both the parents and the institute. Like for
yeah,
example, are there being are the rules for and the rights for kids with Down syndrome explicitly stated or being followed by all the schools? Because sometimes, especially for private schools, they have their prerogative which to adopt and which not to adopt when it comes to the rules. So these are some of the limitations also of the when it comes to the practice of the rights for the kids. So as advocates or as part of the support system for these families, we have, if we can, we have to educate also the parents when they are struggling on this part. Thank you.
yeah,
Yeah.
yeah,
Yeah.
Yes, that's
definitely.
a good point. I would
Uh,
like to add that community support and would help the awareness. We should encourage through this podcast or through our community as specialists to encourage communicate, to encourage to have a community support or a support hub. They can make groups, they can stand together for that. They can share their experience
yeah.
with a kid with syndrome, with Down syndrome. So that is the support, the community. Uh, that's all help for the parents and the children.
Yeah,
Yeah.
to gather
Yeah.
them around on support groups and make them, use up from experience and real actual experience from other, parents and other, specialists that has the same issues, or it is very important. It's a part of the, follow up and training for the parents actually.
Yes.
Yes, and I
Yeah.
guess it's also important that we help them when it comes to referrals to which part of the which department or the government agencies they need to go to, for them to have awareness and clarifications of what are the rights of my kids and what are the rights of my parents, of somebody with a child with Down syndrome. Because these agencies will be the
Mm-hmm.
one to be helping them or even support them if they need legal support for these kinds of things. Because sometimes it really needs some legalities. You have to, especially if they're fighting for the rights of their kids for education, they have to
Yeah,
know the legal rights of the child so that they can really know, how am I going to fight for the right of my child?
Yes,
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 Where
that
can I
is
get
exactly.
the
it's a
Right,
good
support
one.
and
right.
Yeah,
clarification?
and media and social media are so much important and so, gets in so many lives nowadays. It's not like before where we don't really hear of the struggle, but now we are living the struggle and, make, you know, by the step actually,
Yes,
because now,
no,
yeah, we can we see whatever, platform and have special needs children and special needs parents, and they actually talk about their experience, and which helps a lot in doing and knowing what are the issues, and really, make a discussion on and making parents talk about their experiences too, which is
Yeah.
really open up to society and
Mm-hmm.
make sure that the inclusion is real.
inclusion is heaven.
Right.
Yes,
Yes.
Yes.
the
Yeah.
inclusion is should happen in the right way. Their parents would to have no discrimination between them and the others. They have their rights, and through us they should have they have their rights for inclusion and the perfect inclusion. Yeah,
Yeah,
I
I
agree with
also
you.
I always say that it is society inclusion, not just, school system
Yes,
or
yes,
center system. Yeah, it's a school. It's a life inclusion.
five. Yes.
It is a society. We used to have a girl at the center, and her mother took her just to play on the swings. I would say that she was pretty mild. Even her features, they weren't very extreme. She
Yeah,
took her
sure,
to the
because
park.
it is there are mosaic, and mosaic
Yeah,
is, low
yeah. But
feature.
when
Yeah.
she got to the park and she was playing with her child, one lady came up to her and said, "We don't want our kids playing with your child. We don't want our kids to get what your child has."
Yeah,
Down
yeah,
syndrome
yeah.
it's not a disease,
Yeah,
It's
yeah, it's
incredible,
about awareness actually. Yeah, it all come up to awareness, because
Yes.
awareness,
Yeah,
it really helps. We are
yeah,
now so many difference when I began 15 years ago,
yeah.
because
Even
now
when we
there are
started
so
here at
much
One,
experience, and this is what media done, because now you see in the news everywhere, okay, Down syndrome now is going places and doing
yeah.
and achieve so much.
Yeah, but what I feel about the awareness of Down syndrome, since they're doing so much awareness about autism, all the time you see
Yes.
autism awareness,
Autism.
but the Down
Yes.
syndrome awareness has reduced massively. And, and I think there needs to be more awareness brought to Down syndrome and, autism as well. But I think it's now with social media and everything, it's always autism awareness. I see very, very little when it comes to Down syndrome awareness now.
Yes. Autism has now enough support groups, support hubs. So it's okay. Autism have their supporters. So now we have to focus on the others. We have to
I
Yeah,
see
focus
it.
exactly.
I see it.
on
Yeah,
those.
I see it. Takes up a lot of, addressing today, because ASD has been, in the low key for so many years. And since it is not being diagnosed with genetics, not along like Down syndrome, it is much to talk about now because it has so many not it has so many confusions and so many misdiagnoses. Now it is having, yeah, but and now also we can see that ADHD children are taking up the much, of the awareness because of the same thing, because it was all the
Yes, like
time, yeah, misunderstood and misguided and mistreated for so many levels, because we now have the awareness that ADHD children are not just the slacky kids, are not
yeah,
just the,
that naughty
latent
boy
kids.
is making their moves. They are
Yeah,
love.
yeah, yeah.
In,
So it is a
yes,
two-way street. it it really focus on the issue and awareness, which is good, but sometimes it takes up so much time from whatever else we need to be aware. And this is where we came, and this is where the specialist has to work some things like this, and also, make sure that the people understand during, through platforms, through whatever social media, whatever media, to raise this awareness and make sure that nothing is left behind and no child is left behind.
Right,
yes.
exactly. Okay, let me go on to the next one. Let me see. Um, okay, now we're talking a little bit about inclusion. Steps towards inclusion that includes providing classroom accommodations. Schools should implement visual aids, modifies curriculum, extra time on task, and assistive technology to help children with Down syndrome succeed in mainstream classrooms. Creating awareness among parents, which Isra was talking about, educators and policymakers, promoting the learning potential of children with Down syndrome can encourage inclusive policies and reduce misconceptions about their abilities. Rehabilitation centers taking an active role in training mainstream teachers. Special education teachers should provide workshops and training programs to equip mainstream teachers with the skills needed to teach children with mild to low moderate learning needs. Developing inclusive school policies. Schools should establish clear guidelines for inclusion, ensuring students with Down syndrome have access to necessary resources, individualized educational plans, IEPs, and peer support programs. Encouraging collaboration between mainstream and special education schools, partnerships between inclusive schools and special education centers can help share expertise, teaching strategies, and resources to improve education for children with Down syndrome. Okay, who wants to add to that? Most of this have already talked about.
Yeah.
Yes.
Anybody have anything to add?
Yeah,
No?
I can add that it is when we get parents that actually in the school system, and the school system doesn't really provide all of the training, and there is where we you have to suggest centers or whatever that has the missing rehabilitation that they really need. It's not just about, it's the school system can't really hold all the
Yeah.
training.
Well,
Yeah,
I
and
know I
yeah.
I know the Ministry of Social Development, they have started some training. I'm not sure exactly what it is, but I know there was some training going on. Ministry of Education also, they have done some special education needs training for normal for special education kids here. So, it's starting. It's something
Yeah,
that is
yeah, yeah.
starting.
Yeah,
Yeah.
but it is going so many, steps that is taking up so much through the red tape and through whatever the government is really going to take its policy actually.
Yeah.
So we have to make sure that the child is not gonna wait because time is the essence of that
Mm-hmm.
child as the age go by, and he really, we have to he is an academic setting in school, but now he has, some motor deficiency as he is, and he has to take up more classes or more sessions. So we
Yes.
direct them to centers that really provide this,
Yeah.
because
Yeah.
as age go by, it's gonna be an issue.
Yeah.
Yeah,
Yeah.
we have to obtain this point to another point. IEP, individual education plans, should be organized well. Should
Yeah,
including their
definitely. Yeah,
needs, their actual needs. It's not
yeah,
just playing, not just going to have a social life. No, we have to focus on the individual education plans, that
yeah,
they really have the real goals they need in their life, the real goals of uh,
yeah. And
their
actually,
level of
a
education. Yeah.
real, a real, a real goals, which
Yes,
is
I
Yeah.
we
will
can't
go.
emphasize enough, because doing high expectations can really, low up the
No, exactly. Yeah.
advance. Yeah, yeah, the advance of the child. Because what IEB can be, it's setting a much small, goals, and much small realistic one.
It should
Yeah. The
it
goal
should
should be
be organized
realistic
well.
and then they can be revisited. The goal should
Yeah,
be, yeah, they can be revisited every 3 months. If the
yeah,
child has achieved that goals and
Yes,
have
yes.
gone beyond that goal, then we revisit those goals, but they have to be achievable goals.
yeah, definitely.
Okay, let's move on to the next one. Hold on. Okay. So open this. Okay. What are the benefits and challenges of special education centers versus inclusive classrooms? Okay. The benefits, we would say, tailored learning programs with individual supports. Lessons are adapted to the child's learning pace using structured teaching methods that meet their specific needs. Access to speech therapy, occupational therapists, and life skill training, as well as behavior therapy. Um, Lower student to teachers ratios, allowing for personal instruction. So smaller class sizes ensure that the students receive more one-to-one to support from teachers and specialists. Specialized behavior and emotional support. Teachers and therapists are trained to manage behavior challenges, sensory needs, and emotional regulation strategies. Structured environment designed for children with disabilities. Classrooms include visual schedules, sensory-friendly setups, and adaptive learning materials to enhance engagement. Now, the challenges: limited social interactions with typically developing peers. And I think this is like really one of the things that's really important. Children in special education have fewer opportunities to learn social skills through peer modeling with neurotypical students. Lower expectations for academic achievement. The curriculum often prioritizes life skills over academics, limiting access to higher education opportunities. Lack of opportunities for real world integration. Segregated environments do not prepare students for interacting in mainstream society, workplaces, or community settings. Stigma and social exclusion. Placing children in separate centers reinforces misconceptions about their abilities and reduces public awareness about inclusion. Limited career and higher education pathways. Many special education programs do not provide strong vocational training or academic qualifications needed to employ or for further studies. Okay, we have two more for this one. Now, the benefits. It encourages social development and friendships with near typical peers. Inclusion fosters communications, collaboration, and emotional connections between students with and without disabilities. Provides exposure to broader curriculum and learning environments. Children with Down syndrome have access to a wider range of subjects, activities, and enrichment opportunities. Fosters acceptance and reduces the stigma of the community. Seeing children with Down syndrome in mainstream settings normalizes diversity and teaches neurotypical students empathy and inclusion. Promotes higher academic expectations and cognitive development. Being in a general education setting challenges students to achieve more academically while receiving appropriate support. Encourages independence and self advocacy. Students learn to navigate the real world expectations, advocate for themselves, and develop confidence in a mainstream setting. Okay, now we have a lot to say about this. So, who wants to start?
Assalamu alaikum.
السلام
Waalaikumsalam.
I want to just say some word about it. The centers, rehabilitation centers, and the school. It's a very hard decision for the mother to decide to put her kids in a school or in a center. Why? Because if she put her kid in the center, he will stay all the morning time in the center. And if she decided to put her kid in the school, he will stay all the morning in the school. Okay, my kid need more supporting. What she will do? She will take him from the morning school, if normal school. After he finish, he will stay 2 hours for eating or something, and after that she will getting him from the home to other sessions, private sessions. It will be big effort for the mom and for her kids. Just tell me if you understand what I'm saying or no.
Yeah, well,
Yeah,
I understand what you.
Yeah,
Yeah, we understand what you mean. The
yeah.
thing is,
Choosing,
when we are
yeah,
looking at whether the child should go into a rehabilitation center or if the child should go into mainstream setting, how do we determine that? The first thing is that we need to do testing. We need to see the
yeah,
child's IQ level. We need to see the child's cognitive level, educational level. We need to see how their executive functioning is working. So if we see that a child has, say, a 60 IQ, we know that child needs to be in a rehabilitation center. There's no question about it. But if we see that a child has an 80 IQ, 90 IQ, we know that child needs to go into mainstream education. So, with that being said, of course, we know that there that the child will need extra sessions, especially when you're talking about a child with Down syndrome. So that child, may need extra occupational therapy, extra physiotherapy, especially these two. Maybe they need some issues with speech. So if the child's in mainstream education, the parent needs to see how to organize these sessions. Should the child go for 3 days a week? Should the child go for 2 days a week? Maybe not put the child into sessions for a full five. Yeah, I agree. That's very taxing on the child, and it's very taxing on the parent. But you don't want that child at the same time to lose the opportunity to be in mainstream education if they are capable of being in mainstream education. IEP needs to be done. There are now there are actually now mainstream schools. I know three of them here in Muscat that they have the child could be in mainstream section, and they can also have their therapies. The ABA school also they can be in mainstream education, and the therapists can come to the school to give extra therapy in a private room for the child. So it depends on the school, really. Filipino school. Now they have a educational support section, and they have a special education section. So there are here in Moscow there are some opportunities. There is what's the name of that school? Knowledge Hope that gives ABA, that gives occupational therapy and speech therapy at their school. It's an inclusive school. So now we have more opportunities for these kids coming up. But the first step is to see if they are eligible for the mainstream as we have it here. We can't have a child that has a, say, 50 or 60 IQ go to mainstream school. They won't accept it. But if the child has an 80 IQ, has a 90 IQ, this child can absolutely go into mainstream school with support. A shadow teacher, even, a shadow teacher, parents can get a shadow teacher to support that child. But I think inclusive education is important, and I think the child should have a right if they are eligible for mainstream education, if they have the right scores on, say, the IQ test or educational test, and to check their executive functioning skills. If they have these scores, why are they being denied this? It is their right to have, this education. But at the same time, when you have the kids that are low IQ, they absolutely should be in a rehabilitation center so that the rehabilitation center can help them with the skills that they need. Some kids will only be able to learn skills, whereas some kids will be able to go on with academics. It absolutely depends on the level of the child. We can't put all children with Down syndrome into one box, you know? So we have the kids with very mild, we have the kids with moderate, we have the kids with severe. So they don't all belong together in one box. They have Down syndrome, they can't go to normal school. Yeah, the parents have to be proactive. They have to make sure the kids get the therapies they need. When you have a child with a disability, it's taxing, it's tiring, but you have to think, what do I want for my child?
To take
For
the
me,
grant.
when people come to me and they have a child with Down syndrome and they want to do testing, I'll tell them you should not, if the child comes in with an 80 IQ level, I will tell them you should not put your child in a rehabilitation center because this child can go into mainstream education. Um, if I have a child that comes in and the IQ is 50 or 60, yes, I want them to go into a rehabilitation center. But this is something that when you learn that your child has a disability, you need to motivate yourself to do what you need to help your child. Yes, it's tiring. Yes, yeah, it's overwhelming, but this is the best thing for, you have to choose what is the best thing for your child. And the first step is to have the child tested, not just say, oh, he has Down syndrome, he needs to be in a rehabilitation center. No, the first step is the child needs to be tested to see what his cognitive development abilities are. Anybody want to add anything to my lecture?
Yes.
You clear everything, Doc.
Mm.
Yes.
Isra, you want to round off?
Yeah, it's so clear. Since we
Yeah,
are
Yes.
you did a great job there where you handle all the points, actually.
Okay. Okay. Thank you. All right. I'll go to the next one.
one thing that I will can add on, Doc, it's like the readiness of the child with Down syndrome as well, if he or
Yes,
she
the
is ready.
readiness. Yeah. 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 Okay. Let me open this. Let's see. Uh, okay. How can special rehabilitation centers improve their educational programs to better support academic and life skills development? Well, that's when the ministry allows you. Okay. All right. Challenges of inclusive classroom. Is this the right one? Okay. Um, functional academics focus on literacy, numeracy, communication skills that are essential for everyday life. Expand vocational training, teach real world skills such as cooking, money management, workplace behaviors, and consumer services to improve job readiness. Um, enhance social skills training, provides structured opportunities for social interactions outside of school, including role playing, group activities, and community outings to improve communication and confidence. Partner with mainstream schools. Facilitate joint activities with near-typical peers, such as shared extracurricular programs, inclusive events, collaborative projects to encourage social integration. Introduce self-care and independent living programs. Teach essential life skills such as personal hygiene, grocery shopping, using transportation, home management, to prepare students for independent or semi-independent living. Utilize assistive technology, adaptive learning tools, incorporate communication device, visual aids, and hands-on learning materials to enhance engagement and accessibility in students with diverse needs. Now, I know that we at our center, we do teach cooking. Randolph has taken the kids grocery shopping many times,
Yeah,
and I
Yes.
yeah,
Doing
great.
business
um,
Yeah,
myself.
yeah.
yeah, we did before have, this was when I think we were in Moana.
Mhm.
We had someone coming and teaching karate to mainstream kids as well as our kids, but that was like some time ago.
Sure.
I don't think you guys are doing that anymore, no?
we had
Um,
we had one, Doc, flower arrangement.
Oh,
Wow.
yeah,
Yeah.
you've done flower arrangements. Um, I know we've tried to do a lot of collaboration in the
Yeah,
community.
Yeah.
yeah.
But sometimes it's a little difficult. I mean, I remember one time, I don't know, it was quite a few years ago, before Dr. Sonia was the manager, we were going to take them someplace to one of the museums or something, but then they found out the kids were disabled and the place itself canceled our appointment,
Yeah, I
you
remember.
know. But that was years
But
ago. I think
We brought
awareness has
all
come
our
a long
handicapped
way.
children there.
yeah,
Yeah,
now
I think
we do vocational training in Nesto. We
Mm.
are in Nesto. They are
Nestor is a grocery
helping
store.
to put, yeah. Nesto
Mm,
is a hypermarket, so they did putting the grocery in the
In the
plastic
bag.
bag.
Mm.
So
yeah.
we do that one.
Yeah.
Yeah.
Dr. Kausar, if we are talking about transition, that I prepare some my article about that.
Okay.
But I read it at the end of the presentation.
Okay, all right, that's fine. But I know for us as a center, we have done a lot of things, vocational wise, trying to take them out into the community. We have tried to collaborate with some schools. I think there was one in Moala that we were collaborating with before to accept children with autism when we felt that they were able to go into mainstream education. What is our goal in special education? It is actually for the child to be integrated eventually into mainstream, hopefully. Um, but some kids will not be able to if they are very severe. But that is one of the goals of special education is for them to
Is one
be
of the
able to
goals of the
integrate.
support
Yeah,
system.
yeah,
The
yeah, to
yeah,
be able
so
to
yeah,
go into a
it's
school
okay
system.
if the child is severe, then he needs constant support,
Yeah,
which
yeah,
we really emphasize because it doesn't go out on an age or on a level.
yeah. But
Okay.
when a child is mild, they can read, they can write, they can
Yeah,
do
yeah, it's
many
not,
things.
but yeah, and
It's
if
important that they
yeah,
learn these life
essential life
skills.
skills is so important. Since I've been in the school system and also in center system, I really work both, and it is, if it is your job, or you want to do that, you really do it, because I've been with the clients that has whatever. I'm talking all special children, and
Mm-hmm.
in the school system I really include them. And since we are not gonna go out to a hypermarket, but there are the school cafeteria, and we're gonna go there and really train on how to order and how to eat independently and pay money and deal with this life issue. Because what a school I really see is a miniature society.
Mm-hmm.
Once you are including in the mini society, this miniature society, you can train to live up in the bigger society, which is the whole
I
life,
agree
your
with
whole
this
life.
point because we have already in the centers I worked before that we first have a role play for this like they are uh, uh, they are the chef and making the food. We are pretending that he is a chef. He has that hat for chef. They had
Yeah,
the knife, his spoon,
sure.
everything, and they are playing a role play. We are in grocery before we go to the grocery shop. We have to have a role play. He is a sales or he
Yeah,
is
and the
a
theme,
buyer.
yeah, with the theme, play, we can tell them, okay, now it's pretend play, and it's
Just
imaginative
pretend
play,
to
and then we train them to go out in, a
in the
more,
real life.
yeah, control
Yeah,
setting, and then
yeah.
to
Yeah, we have
the
taken
level.
actually, I think Randolph, you were the one that you and maybe Dr. Sonia, we took those kids for the pizza making in
Yeah,
Altold, I think it was, where they had collaborated with one restaurant, a pizza restaurant, for the children to go and learn how to make pizza.
Yes.
yes,
And they loved it. They,
Yes.
they
Because they
loved
have
it.
to
They
eat
had
after.
so many, huh?
Because they have to eat it after.
yes.
Yeah,
It's all
yeah,
about
because
motivation. I
That's
mean,
yeah,
he's
that's
not,
actually a good
yeah,
support.
he's
Yeah.
not
But
gonna
they love
really
doing
like
it.
it if
Actually,
he's
they
not
love
gonna
doing
eat
it.
it after. Yeah.
yeah, yeah. Yeah, so they did go to do that where they got to make the pizzas and
Mm-hmm.
it was one of the pizza
Yeah,
places near the
yeah,
center,
sure,
and they
sure.
Mm-hmm.
absolutely enjoy it. I can say Dr. Sonia and Randolph and the other staff, they Shema and everybody, they really try to find great community activities for the children to participate in,
Yeah,
you know,
yeah,
so
definitely.
that they not are only in the walls of the center, but they try to get them out into the community to do things.
Yeah,
So that is one thing that I can say that we have done, and we have, we try to accomplish this. But being, here in the Middle East, it's sometimes it is challenging, but Dr. Sonia always manages to find something. Okay, we want to do this. Even Randolph. Okay, we need to try to find place something for the kids. So we always try to find something that the children can go out and learn from. The pizza making, Nesto bagging groceries. You got them to do cashiering one time too. I remember the older boys, so
Yes.
that they were
yeah,
able to
Yes,
work
yes.
at the cashier
yeah,
as well.
yeah, yeah,
So,
yeah. It's about
um,
life experience, yeah,
yeah,
and different life experience. But
yeah,
here in the Middle East, we also do this. I did field trips for I did daily sessions on grocery shopping and really actually done till they have the checklist and do, cross the checklist of the
yeah,
grocery
yeah,
shopping whenever, because it is so important. It is what promotes independency, which
yeah,
is what we are really looking for, a child well-being and child welfare.
yeah. Now, I have an older son who is on the spectrum. And what
Yeah.
I've done with him, he's 25 now, I make him pay all the bills for the house.
Yes,
you know
yes,
and this he has to send the rent, he has to pay the electricity, the
yes.
water, and the
Yeah, and
internet.
it's
This
all
is his
about the
job at the end
checklist
of the
and
month. I
organizing.
transfer the money
Yeah,
into his bank account,
yeah,
and
yeah,
that is his job. You
yeah,
have to go and you have
yeah.
to pay all of this, and he's really learned responsibility
Yes,
from doing this. I think for 6 months I had transferred all the money into his account,
yeah,
and this was to teach him financial spending.
yes.
All of my money was going into his account. This was a really big jump of faith, to do
The
this.
leap of faith.
So
Yeah,
yeah. So what he had to do is he had to order the groceries.
yeah.
Um, Oh, okay, Sheila. Her laptop is low on battery, so she's going to transfer to
Okay.
her phone.
Okay.
Um, so he had to order the groceries, he had to pay the bills, and anything that he was left, he had to send back to me, so that I could see, how his responsibility was and how he was going to adapt to life later on. And he actually, the first couple of months, he didn't do a very good job. Very good job. But
The training
as
process. Yeah.
yeah, but now he's really good, and he's the one that reminds me, "Oh, mommy, we need to pay the electricity. Oh, mommy, we need to
Yeah.
pay the rent."
Yeah.
So he's the
Yeah.
one now that he reminds me that we need to do
Yeah.
these things.
Yes.
So it is, training, and it
Mm.
is, they learned you know from us teaching them.
Yeah.
So
It's about the basics.
this is
Once
a
you
very
said the
important life
basics,
skill,
yeah,
is
once you
financial
said,
budgeting.
yeah, yeah, once you said the basics, you train them on, small shopping, you train them on money spending and how to, do all of this. And then you come up to what this level is. He is responsible this now.
Yeah, now like if I want him to deposit money, he can go on his own now. He'll just go get a taxi and he'll go deposit the money. If you say 2 years ago, he couldn't do that, you
Sure,
know?
sure.
So
you know
now,
what? You
yeah,
know
so
what?
now he can do
This
all of that.
experience.
Mm, yeah,
What,
You know
Mohammed?
what? This experience must worth to share with the other parents, worth to share with the
yeah,
supporting groups with the parents, that they have to know our children um, can do that. Our children can be independently doing this stuff of work. So we have to share it. We have to share
Hmm.
this experience
yeah,
with them.
yeah. Yeah, since you are doing with you have lived this experience and it is a life experience, you have to share it with more and more people and more,
Yeah, yeah,
specialists and parents because it gives hope and it also make sure that the parents, okay, you can have that with
yeah,
your child.
yeah, yeah,
Yeah,
exactly. That's what I try to share with parents that are coming in, and they have a child that has autism, a high functioning autism, maybe, and they feel so horrible that their child has autism. And this is one of the examples I give them is that, it's your child is high functioning, or even if they're mid functioning. Your child
Because
can go to normal schools. Your child can achieve. Your child can drive. Your child will be able to get married. All of these things, and I do share my experience, with my child.
yes, yeah,
Yeah, the more you involve your son or your child to a certain task, the more they will love doing it and the more they will
Yeah,
learn from it. Yeah.
yeah.
yeah, yeah. Okay,
Yeah.
let's go to the next section. Hold on. Let me see. Okay. What efforts are being made to increase school inclusion for children with Down syndrome, and what barriers are still existing? Efforts to increase school inclusion for children with Down syndrome, advocacy campaigns to raise awareness about inclusive education, disability organizations, parent groups, and educators promote the benefits of inclusive education through public events, media, and policy discussions. Pilot programs in some schools allowing partial inclusion. I think this one is a really good idea. Some schools introduce inclusive models where children with Down syndrome attend selected classes or participate in extracurricular activities outside their neurotypical peers. Teacher training programs and special education strategies, professional development workshops, equip educators with the skills to modify curriculum, manage diverse classrooms, and assistive technology for inclusive teaching. Collaboration between special education centers and mainstream schools. Special rehabilitation centers offer training and resources to mainstream educators to help them support students with Down syndrome. Parent involvement and advocacy, which we've talked about. Parents play an active role in pushing for inclusive policies, sharing success stories, and working with schools to ensure that their children receive appropriate accommodations. Okay, there is one idea that I, yeah, there's a lot of, yeah, I agree. There's a lot of background noise. I don't know
Mm.
where it's coming from either. Um,
it's an echo.
um, yeah, it's some kind of echo or something. But anyway, the one idea was to collaborate with mainstream schools so a child with Down syndrome can go a partial day for certain subjects. Now, that's a really good idea. I think that is really a good idea because you can see how the child will do in inclusive setting, and then they can be, say, trained to go longer. um, so for me, I think that that one suggestion right there, I think it was a really, really excellent one. Anybody else have any?
Um, Probably I'll just share a little bit because currently our therapy center have been working very close, but most of the time will be together with the kindergarten phase and also play schools, because for us to go and engage with the government schools is going to take some effort, because it's going to be like a very formal application, something like that. So
Yeah,
maybe going to international schools is still
or private
okay.
schools.
Yeah, a private school. So the collaboration is more a lot of easier compared to the government schools.
Yeah, the
But
private
then
schools would be better
for
anyway because there
mm-hmm.
aren't as many kids allowed in a classroom in a private school, whereas a government
Mm-hmm.
school can have a lot more kids. So
Yes, yes.
the private school would probably be more appropriate for, like, a child going, say, from 7 to 10, or the school's open here. Yeah, 8 to 10 or 8 to 11 to a
Mm-hmm.
private school for certain subjects, so they get used to being with neurotypical kids. So, I mean, I think for me personally, I think that's an excellent idea.
Yeah.
Yeah, I would
And
recommend it also for, first timers in an inclusive, room, or inclusive
Yeah,
teaching room, but then gradually into a full day
a full
inclusive.
day.
Yeah,
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 it's something that you build up, just
yeah,
like we build the kindergarten kids
yeah,
up, like 2 years, they are going till, say, 12 o'clock. And then when they go get into grade
yeah,
one,
yeah,
they
yeah.
go
They go
into,
to 1 p.m.
yeah,
and then
they
to
go into
2
the
p.m.
longer
and
day.
then yeah, yeah.
Yeah, so it would be a build up, but it is a good idea to collaborate with mainstream private schools and to see how the child will be able to interact in the
Respond,
classroom.
yeah, yeah. It's about his response and about his transitioning into the classroom,
Yeah.
environment.
Okay. Anybody else have anything else? Dolph, anything? Okay, let's go to the next one. Oh, okay, this is next to the last section. How can IEPs be designed to meet the needs of children with Down syndrome in a special education setting? Okay, so this is one thing Isra already said. Set realistic, measurable goals in communication, academic skills, and independence. We don't want the goals to be too high or they won't be able to achieve those goals. Goals should be individualized based on the child's current abilities and focus on gradual progress in areas such as speech, literacy, numeracy, self-care, and social interactions. The visual support, structures, routines, and assistive technology, incorporating picture schedules, step-by-step instructions, and tools like communication devices or adaptive learning software enhances understanding and engagement. Involve parents and therapists in goal settings and progress tracking. Regular collaboration between teacher speech and occupational therapists and parents ensure that the child receives consistent support at home and at school. Adaptive curriculum includes life skills along with academics. In addition to reading, writing, and math, IEPs should include training in self care, money management, social interactions, and vocational skills to prepare students for independent living. Implement flexible assessment methods. Traditional testing may not accurately reflect a child's abilities, so alternative evaluations such as performance-based tasks, hands-on projects, and progress tracking through observations should be included in an IEP. Okay, IEP makers, where are you? Did Dr. Sonia disappear? No, she's there. Okay. IEP makers, where are you?
Yeah. IEP is actually institutionalized. It depends on, you know, uh, how the center developed their IEP. But the common denominator here is that IEP should be the goals that must be written there should be, we have already talked about it. It should be measurable, should be realistic, right? And it should not just only be limited in a certain box. We have to involve as well the parents in making the IEP.
Yeah. Yeah, exactly as we said before, that they should be measurable, but they should also, they need to include also life skills. They need to include academics sometimes, and transitional things, because
And
sometimes with the hmm?
constant evaluation of the
Yeah,
progress. Yeah,
yeah,
and setting the goals and modifying them for what actually is the challenges on the real life challenges that the kids do and appear during the process of IEB and during the process of classroom, setting.
yeah, yeah. Because it's important that we set up the long-term and short-term goals for each child. The IEP is really an important step, and I think there are some areas for improvement if the child is in a rehabilitation center. A lot of times, sometimes that, we're not setting up a whole lot of academics. We're looking more into the rehabilitation area. So I think academics need to be also important. I mean, the child grows up and he doesn't know how to read, he doesn't know how to count and stuff. That's a big thing. So I think academics also need to be included in IEPs for rehabilitation centers. They are included in the IEPs
Yeah,
if they're
yeah,
going into mainstream education. But
yeah. And IB meetings is also so important
yeah, yeah,
because yeah, it really help develop what is the image now and how we can achieve it through the whole team because we have the academic specialists and the parents and whatever working with the team or who is in the team, and it is very important. IEB meetings I see in the US, IEB meetings is much
they're more
accounted
advanced,
for.
I think,
Yeah, yeah, yeah,
because
yeah,
they have a legal advocate in the
yeah,
IEPs, in some
yes,
cases in the US.
yeah,
Mm.
So the parents know their rights and the rights of their child. We don't have advocates in the Middle East for children with disabilities.
yeah,
Advocate is basically a lawyer. So
yeah.
actually, somebody asked me about this just a few days ago, and I told him you'd have to just go to a family law lawyer because we don't have advocates here or
We
lawyers
don't have
here
a law
that
mandatory,
specialists, yeah, that are
yes.
specialists for special education.
Which
So,
is we have to must mention that since they are, law mandatory because it gets in the insurance of the child, and it is what the government really, uh, accounted for
Mm-hmm.
through that, because it is, supported by government and insurance, health insurance, what is a society
Socialist.
insurance. So it is so important for them, and this is where we have this gap, because here in the Middle East we don't have this, you know.
Yeah, yeah, yeah.
Yeah,
We don't have the same type of setup as they have in the United States. So that is for sure. Um, and but I know for IEP meetings, advocates are welcome to come in, and that is usually a lawyer for the parent that specializes in laws for children with disabilities. So in the United States, we have the IDEA Act, and we have also the Law for Peoples with Disability Act. So, there are more things available, within the United States as far as the laws are concerned and the parents' rights. But here in the Middle and East and Asia, they haven't come that far, but they have come a far way. I know with the ministries here, they are trying to get more laws into place or regulations into place for children with disabilities so that they have more rights to different education settings.
In the IEB, I would like to add that self-care and independency should maintain, the IEB should maintain this matter, these settings. So they have an independent life, like the experience you mentioned before. So IEB and IEB makers should know that they have the rights of self care. They have rights of independency, so
Yeah,
they can
self-care is
actually
a very important one. This
yes,
is a lot of kids with disabilities, they have difficulties in self-care. So
Yeah.
self-care is actually a really important one.
yes.
yeah,
And to add on
um,
of that, based on experience, no, um, we really have to give emphasis also of putting self-help care development in IEP among
Hmm.
with Down syndrome. Why? Because we have this one incident that a teenage girl who happened to start her menstrual period, and then if we are not teaching them how to do self uh, how to clean something like that, no, with this, because they have already periods like that, and then it is not just only a struggle and challenge amongst nannies or caregivers or special education teachers, especially in the classroom, but I believe it is also a struggle or challenge amongst parents and guardians who have teenage girls with Down syndrome having menstrual period.
Yeah,
And if we are not teaching them, it is a big mess. And we are not
yeah,
just only
yeah.
talking a 1 day menstrual period. We are talking about 4, 5 days menstrual period in a month. So we
Hmm.
really have to put emphasis and put this on IEP about
Yeah,
this.
yeah.
yeah,
This is something that definitely should be
yeah. It's all
taught.
about the needs. Yeah,
Yeah, we have
and
we
it's yeah,
Yeah, we faced this problem a couple of times, and sometimes even when we put it in the IEP, and we try to get the parents to teach their child about this, that this is going to be something that's going to happen, you
yeah,
know, the parents don't teach it, and sometimes the child has no idea what it is.
Exactly.
I remember one case some years ago, maybe when we first opened. One girl, she started her menstrual cycle. She didn't know what it is. She's crying, she's screaming because she thinks she's dying, you know. But because this skill was not taught at home, that this is going to happen to you. I
Yeah.
remember when I was a child, my mother prepared me for it, you know.
Yes.
So even if your child has a disability, you need to try to talk to them about it to prepare them for it so they're not shocked when it happens, thinking that something's wrong with them, you know?
Yeah,
So,
it's all about
yeah,
preparation and
so this
setting them
actually is
to what's
something
next.
that, yeah, so this is something that is important to put into an IEP. You can use
Yeah,
pictures, you
and
can
you
use so
can
many
use,
different
yeah, sure, you
things
can
to
use
teach
visual
them.
aids and do a whole theme on it
And
because it
Yeah,
actually, we
is
are
yeah,
said that.
we are recommending parent to let her daughter wear a diaper instead of a napkin when there is a menstrual period, because it's easy to remove and it is easy also to put
To
on.
change, yeah.
Yeah, yeah.
yeah. They have those afterbirth kind of diaper like things, and those actually kind of work better.
Yeah, and
The
it
ones that
also
they give women
promotes
after they
what
deliver.
you really have to learn to make sure that they learn is actual hygiene and better
Yeah,
hygiene for every, for boys and girls. So it is what you are trying to teach because it is reaching independency must be on this, you have to take more hygiene better of
yeah.
yourself, and
Yeah,
yeah, it
hygiene is
is
a
because
very important thing. I mean, a lot of the kids, they don't like to take baths. The water is
it's a
sometimes a
struggle.
sensory issue.
Yeah, yeah, yeah.
But we have to encourage them. We have to teach them that bath is something that is necessary. It's not something that is optional. It's how you keep yourself clean. So, these are things that need to be included into an IEP.
Yeah, true.
I just
Okay,
have
I'm
to,
going
to
to.
add what, Doc. I just have to add one. It's a funny thing, no? I was actually being complained one of the parents before, because we are taking a bath in the IEP, and then we are teaching the child to take a bath every day. But we have to consider also the culture that they have, that they belong, because the father himself went to the center and complained against me. Why my son is always in the bathroom taking shower every day. That's his just only like
Yeah,
yes.
yeah, I think we've had a few of these kind of complaints,
Yeah.
you know,
Yeah, it's
but you know,
understandable since the
I
culture,
said, okay, sir, it's
differences.
fine, it's fine, it's
Dr.
fine.
This
Sonia,
is why we like, ABA, because ABA says there are cultural consideration you have to take. So if I'm gonna teach the child that there are 3 meals a day, and he goes home and there are only two or there are only up to 5 meals, and I'm just teaching him about three
Yes.
meals a day. So here is what's the cultural differences we have to put in our mind and put it in hand to put it this in this, his whole program, and
Exactly.
his cultural differences is so
Exactly.
important.
And one thing
Yes.
more, I'm sorry. Yes, go ahead, ma'am.
Yeah, yeah,
yeah,
I'm finished. Go ahead.
And one thing more,
Sir
um,
Rondon,
and one thing
if
more,
we,
it's
if
that,
we are keeping telling about the hygiene, I can see Dr. Sonia smile about that.
yeah. And one thing more,
I
because
I
we are,
I keeping my tongue inside my mouth.
we also teach our kids using utensils in eating, right? The spoon,
Yes.
like that.
Yes.
And the culture itself says that no, we are not using
You
spoon
are eating
when
by hand.
eating. We
Yeah,
are using our
yeah,
hands.
yeah, yeah,
No,
yeah.
no,
yeah,
Yes,
I
that's
yes.
think
it.
I think that one
That's why
actually depends
IEP
on
should
the
be adapted.
family.
Yeah,
Yeah,
and
yeah,
I think
this
that's
is
Yeah.
what we
flexible.
are saying. Yeah.
Just
Yeah.
little
Yeah.
family
It's going
dog
to
that using
depend
the
on the
spoon.
family.
That's it. Yeah.
Little family dog
So
using
that's
spoon.
Yeah. There are quite a few
so we
Omani
just teach
families
them
that
how to
do.
wash their hands properly before and after eating. That's
Yeah.
it.
Yeah.
Yes,
Okay. Let's go on to the
yes.
next one. Okay. Where is it? All right. So this is social and emotional development. I think I went up too high. Yeah. Okay. How does segregation of Down syndrome uh, in special education centers affect their social development? Okay. It limits their abilities to develop relationships with neurotypical peers. Children with Down syndrome miss out on daily interactions with typically developing classmates, which is essential for learning social norms, communication skills, and building friendships. Reduces opportunities to practice social skills in diverse environments. In segregated settings, children primarily interact with others who have similar challenges, limiting their exposure to different communication styles, behaviors, and solving situations that are common in inclusive settings. It reinforces stigma by keeping them segregated from mainstream society. Segregation reduces the belief that children with Down syndrome cannot participate in mainstream education, leading to society misconceptions about their abilities and potentials. Decreases chances of learning through peer modeling. In inclusive class environments, children with Down syndrome can observe and imitate neurotypical peers, helping them to develop stronger language, behavior, and adaptive skills, which are harder to acquire in segregated settings. Makes future integration into society more challenging. Limiting exposure to real world social situations can make it harder for children with Down syndrome to transform into mainstream communities, activities, employment, and independent living as they grow older. Okay, so give me your feedback on this and who got kicked out while I was reading. Let's see. Sheila got kicked out and Afika got kicked out. Okay, they're back. All right. Uh, all right. So, what is your feedback on this one?
Well, as we said, that as and center setting can be some limited, but and promote segregation, but we can do this by promoting, life skills and out of
Hmm.
the center, like shopping
Yeah.
skills and money using skills and field trips and whatever.
Hmm.
This is where we exclude segregation from
Yeah. There's also
centers.
play dates.
Yeah.
Play dates. Play dates help kids with Down syndrome that cannot go into mainstream education. It helps them to develop skills with neurotypical children. So that's another one they can do. And okay, Miss Afiqa has to go because she has to do an assessment. Okay,
Thank
I'll
you.
see you
See you
soon,
soon.
inshallah.
Okay, thank you,
Okay,
everybody.
all right.
Bye-bye.
Bye bye. So, play dates is a very important one that where they can, you know, learn to, you know, uh, learn to communicate and stuff with a neurotypical
Yeah, and
peers.
and
Also,
play skills also
the
is so
park is a big
important.
one, especially here in
Yeah.
Oman. In the
Yeah.
evening in the park, it's full of kids. So that is another way. And most kids are kind. Most kids, I would say, are kind. You have a few kids that will be rude to the other child, and the parent can involve themselves in that. But, you know, I have found that mostly the children are kind, with kids that have different needs. So that's another way that they can develop skills with developmental and neural kids. So neurotypical kids. So there are ways, if especially if the child is unable to go to a mainstream school.
Yeah. And play skills is also so important because it get developed so fast, which promotes another, you know, uh, development in
Yeah,
levels. Then,
yeah. Play skills are really, really important. Okay, let's go to the next one. Okay, what strategies can help children with Down syndrome build meaningful relationships with peers outside of the rehabilitation centers? Okay, inclusive extracurricular activities, enrolling children with Down syndrome on sports teams, music classes, or art programs provide opportunities to interact with neurotypical peers in structure engaging environments. These activities encourage teamwork, social bonding, and skills development, and while fostering friendships. Community-based programs establishing buddy systems that peer neurotypical children with peers who have Down syndrome help create meaningful connections. Programs like scouting, youth clubs, volunteer programs provide natural opportunities for friendships and social learning. Encouraging family and social gatherings, organizing play dates with what I just said, outings and community events where children with and without disabilities interact in a relaxed settings, help build friendships. Families can also coordinate social meetups in parks, recreational centers, or cultural celebrations. Now, here we have a lot of these types of programs here, and the kids with Down syndrome should be encouraged to join things like the Scouts. We lost somebody. Okay, Sheila. Okay, uh, there's Scouts here, and I know some of them they will take kids with Down syndrome. So that is, one program. There are cultural clubs. There are sports centers, the Boscher Sports Stadium, and also the Alhul Sports Stadium. They have so many activities, and I think you pay something like 10 reals a month or something. It's really inexpensive. So they have so many different types of things that kids can engage in. They have soccer, they have tennis, they have aerobics, they have so many different types of things that people can engage into. And then there are these clubs, soccer clubs. There's one there in Al Holf. There's one here in Alamora. There's some in Funja. There's all around the country. Each city seems to have a sports club. All of these things would be good for the kids to engage with. And there's another guy. He teaches basketball for kids, all kids, with disabilities and without disabilities. There is horse riding clubs. So there's so much that parents can enroll their kids in, but they need to know these resources. Actually, I have them listed on a document that I give to parents of different things that the child can engage in. Hello. Okay. Can y'all talk? I think we lost. Did we lose Sheila? Okay. Okay. Continue.
Yeah, swimming also is also good for them. Swimming.
Huh?
Yeah. We have also now,
Yes,
yeah,
swimming,
yeah.
swimming. Swimming is also another one. I think y'all
Mhm.
have, some of the kids go to
We
that
have
Yes.
one.
we have some kids in our centers that already in the champion, some champions, like
Yeah,
Muhammad Al
yeah.
Farousi and Azam Al Hadrami. He was in the champion of riding horse in Al Emirati states.
Yeah, because the riding horses and the swimming are two of the main two that I actually recommend. You
Mm.
know, so these are two that I regularly recommend. Is are these these two. So there are things to help them to get more engagement from the community.
Yeah, that's true.
Yeah.
Yes, it's
Well, sport. Yeah, sport is really important for anyone
Yeah,
actually.
yeah, the
So
sports is important.
yeah. So once you get organize health, it organize better taking, you know, welfare of the child and welfare of the individual in the community, and it also promotes group bonding
Yeah,
since
group
you
bonding. Yeah,
yeah
yeah.
yeah and sharing and much more, and acceptance of other losses, and all of these, what we call support morals, is so much important in the real life and so much important for any kind of individual, whether it is typical or neurodivergent. So I
Hmm.
say it is my children, when they were young, I always say, okay, you have to engage them in some sport. And for our community, it's not that understandable, because some people really come up to me and say, okay, they have pressure enough on studying and going to school every day. How come you never? I say it really does make them learn more than they can know, more than it is about life experiences and life morals that they really can take in a classroom, that really can't learn just in the classroom. It's what beyond sport. It's about morals and
Yeah,
uh,
yeah. And
and other.
rules. And rules.
Yeah, and responsibility and so many stuff in sport. I can't stress on sport enough, because it is what I see is a life experience, because it makes them really understand what life is all about through sports.
Mm, yeah. My father was the same way. He made all of us participate in sports. I
Yes.
participated in the swimming and soccer, believe it or not. I used to be able to
Yeah,
play
yeah,
soccer.
yeah, yeah.
Uh,
I also, because here is some of the community, say, okay, just make the boys just play or stuff. But I say a boy is like a girl is like a
yeah.
boy. They all need
Yeah, no,
this.
my father made everybody to participate in sports. It was something that, he also believed in. It was something that encouraged discipline. So I think all of us participated in something at one time or another.
Yes,
Okay, let me
yes.
go on to the next one as soon as I find it. How can parents and educators work together to improve confidence and independence in children with Down syndrome? Foster self-help through daily routines, encourage children to take part in dressing, eating, hygiene, and household chores. This is something that is important. to build independence. Use step-by-step instructions, visual schedules, and hands-on practice, both at home and at school, allows children to learn at their own pace and develop confidence in their abilities. Provide opportunities for decision making. Allow children to make simple choices, such as selecting what to wear, choosing between activities, or help planning their schedule. Strengthening problem solving skills gives them a sense of control over their daily lives. Over their daily lives. This reinforces self confidence and helps them become more independent decision makers. Use positive reinforcement, recognizing small achievements through verbal praise, rewards, and encouragement motivates children to try new tasks on their own. Encouraging efforts rather than just the outcome helps them build resilience and confidence, making them more willing to take on challenges.
Yes.
Promote consistent expectations across home and school. Maintain clear and consistent routines, behavior expectations, and learning strategies in both environments creates a structured, predictable framework that supports independence. Parents and educators should communicate regularly to ensure that the skills being reinforced at school are also encouraged at home. Encourage peer interaction and social confidence, providing opportunities for children with Down syndrome to interact with peers. Group activities, inclusive play, collaborating learning experiences helps them build social confidence. Peer support and friendships play a crucial role in reinforcing self esteem and encouraging independence. Okay, comments.
Okay, for me, I guess it's important that the parents should have an awareness that of how much trust they have on their children for them to be able to reinforce the needed empowerment for the child, because most of the time one of the struggles also for the implementation is when the parents are boxed into the diagnosis of the child, that okay, like they have that belief that the child is a slow learner and everything, that because of that they limit the child's exposure, they limit the child's potential because of that belief. So but if that would be resolved on the parents, and they would be focused more on every milestone as an appreciation of the win of the child and both them also, this would help empower both the parents and the child to do more and focus more on what the child is able to do rather than what the child is not able to do or challenged to do.
Yeah. Is somebody vacuuming? I don't know. There's some really bad, what do you call it? Vacuuming sound.
Background noises, just
Yeah.
like
I don't know where it's coming from, but it's coming in and out. So I don't know if there's some kind of
I think Miss
mix.
Sheila is outdoor,
In,
which is
oh,
causing this loud
oh, okay.
vacuums, this background. Yeah.
Okay. Okay.
So
Anybody else?
I've recently, done a collaboration with Dr. Joe Sihon. I don't know if you've seen this, but he really put a lecture for us on executive functioning and how they train it on a more progressive approach they have. And what he really, that he instructed that the executive functioning skills, which is I think cover all of these, because they have trained for delayed gratification and being mindful of your surroundings, and action matches desiring, and all much more, and time management, and after and before, first and then, and feel the fear and excitement thermometer. All of these, executive functioning skills, which dating can cover all of these, because it is a lifelong process. And once you set the base for it, you can, the sky is your limit.
Yeah,
So,
yeah,
yeah.
because executive functioning skills, and to help those skills, once you help those executive functioning skills, you see the child get a lot of improvement. Executive functioning is very, very important. And, building memory skills, building planning skills,
Yeah.
inhibitory to control skills. These are, massively important. And once the child starts to build those skills, you see, how they blossom.
Mhm.
Yes,
Yeah.
yes, and I was so amazed by it. He really did, and an inspiration for us. And did what he did is he bought, got it and bought it for a PDF file, and really handed for us, in order to, be motivated not to, delay this, but actually started on, and how we can, use, more progressive approach to train it, and use models and stuff like that, in order to set the base and really get going with it, because it really makes the bigger
Yeah.
difference in child life.
Anybody else have anything to say?
Yeah, parents and educators are playing a very vital role for the growth, for the learning, for independence, and for kids with Down syndrome. So if a child is in the rehabilitation in the area of SPED, it must be that the environment, the learning environment, should be friendly environment. The learning should be fun, because I believe, from my point of view as a special education specialist, the child who has Down syndrome would actively participate, would learn more if the environment is not
It's
pressure.
fun. Yeah.
No, if the child is at home, as what Coach Sheila already explained a while ago, it's not. I mean, the bonding should be there, and the child should always be involved in the task given to them.
Hmm.
Yeah, so that it
Yeah.
will also
If
develop them sense of responsibility
yeah.
and independence later on.
Yeah, if the task is fun, the child is going to do it. If the task
Mhm.
is not fun and it's too difficult, the child is not going to do it. If
Yes,
the
yeah,
task is fun, he's going to finish it quickly. If the
yeah,
task is not fun, he is going to sit and pretend like he doesn't know what to do.
exactly.
So the task should be fun for him to
Mhm.
Yeah, and
fun for
should be modified for the child level. It's not something that is
Yeah, no,
bad.
it
Yeah.
should still be on the child's level, but the thing is, it should be something that motivates the child.
Mm-hmm,
Yeah.
exactly. It's not just that you
Okay?
have to give only worksheets on the table and let them just to develop their independence. It should not be that way.
Yes.
Yeah, exactly.
Um, I want to add one point about the people who share with us um, uh, how to make training for the kids. Not only the parents, we have also the brothers, and we have also the housemaid. And sometimes the housemaid is more closer to the kids more than the parents.
Yeah, that's true. That's true.
Mhm.
Yeah. Yeah, training for the housemaids. I think that is something that is really important, and that is something that should be done.
Yeah.
Um,
That's why,
you
Doc,
know,
in the
so that they,
center, I'm
huh?
sorry. I'm sorry. Yeah, go ahead, Doc.
Yeah. I mean, the training for housemates is, really important. And like you said, siblings, the brothers and sisters, and things like that, on how, especially if they're older than the child, on how to help them, how to assist them, how to teach them. So these are also, important people that also should be trained.
Yeah.
It's like a bird wings.
Yeah.
It's like I can see it. It's a bird wings. We have two wings. The teachers and the centers is one wing, and the other wing is the parents and the sisters and the other people who share with us.
Yeah, yeah, exactly. I agree
And
with you.
actually, we are doing that
Okay.
one, Doc, already. I mean, Dr. Sonia is already allowing nannies and caregivers to be
Mm-hmm.
in the center with the child for
Yeah,
for
yeah, yeah. I know that a lot of the
yeah,
caregivers do come,
yeah,
yeah, to the center.
yeah.
Okay, let me go to the next question. It is, okay, this is the next section. Okay, health and therapies. Okay, what is the most common health challenge for children and young adults with Down syndrome, and how can they be managed effectively? Heart conditions. Regular cardiac checkups are essential to monitor heart defects and ensure timely medical interventions. Thyroid disorders. Routine screening helps with early detection and management of hypothyroidism, which is common with individuals of Down syndrome. Hearing and vision issues. Annual evaluations and early interventions help prevent complications related to frequent ear infections, hearing loss, and vision impairments. Gastrointestinal issues, conditions such as acid reflux, constipation, and celiac disease are common and require dietary management, medical treatment, and regular monitoring. Low muscle tone and joint instability, physical therapy, and strength building activities
Yeah.
help improve mobility, coordination, and posture, reducing the risk of orthopedic issues as the child grows. Okay. Who wants to comment on this one? Dr. Sonia?
Uh, yes. Children with Down syndrome often experience a range of health challenges due to genetic condition that we talked about just now.
What is that?
That is
Okay, hold
that.
on. I'm going to mute this one. I think it's coming. Okay. Okay, continue,
Okay.
Dr. Sonia.
And it affects on multiple body systems. So ongoing healthcare management is essential for them. Regular medical screening, early detection, and preventive care can help address common health concerns effectively. One of the most serious concerns for children with Down syndrome is congenital heart disease.
Mm.
So regular cardiac checkup with pediatric cardiology is important for them. Besides the thyroid, like we mentioned that hypothyroid also common in uh, children with Down syndrome, then that can lead to slow growth and then weight gain and then fatigue, the allergy to do sports, and even the cognitive difficulties. So it is also important to do routine thyroid screenings. And then the other medical issue is hearing and vision issue that these children are born with sometimes born with mild to moderate hearing loss, or they suffer from frequent ear infection. So it affects all to language development progress. So annual hearing tests and regular monitoring by ENT specialists also recommended. The vision problems uh, also highly prevalent that these children might suffer strabismus, cross eyes, nearsightedness, farsightedness, and sometimes cataract. So that's why there are many children with Down syndrome use glasses to help them for academic achievement. So regular eye exams also is important for them. And like we mentioned at the beginning, digestive issue, acid reflux, constipation, also an issue for this Down syndrome. In our center, there is one kid Down syndrome that always come to the office and complain about uh, pain in his stomach. So we can understand why this kid always come to the office and complain about his stomach problem. But medical treatment will be good for this kind of complaint. Regular checkup with the doctor is essential. Thank you.
Yeah.
Okay. Anybody have any other statement about
Yeah.
the health
Yes.
issues of children with Down syndrome?
Yeah. As far as my observation, though, I always observe that kids with Down syndrome who will always have runny nose.
Yes.
Yes, they will always have runny nose, and then I do not know why, because it's not. I do not know. I just want to ask you for that, if there is like a relationship physiologically, something like that with them, with their uh yeah, yeah, there's there,
Yeah.
yeah,
Also,
and that
the immune system, because of the immune system also disturbed in uh, children with Down syndrome. So that's why
mm,
it's common that these children have running nose, common cold,
mm,
so easily infected. And then after
mm.
that, the teacher also got infected, right?
Yes, that is why we
Yeah.
should have to put in the IEP how to do hand washing, prepare always the hand sanitizer. Thank God, because Dr. Sonia will always give us hand sanitizer.
Okay. All right. Um, what types of therapy, speech, occupational behavior are the most effective for children with Down syndrome, and how accessible are these services? Okay, speech therapy helps improve communication, articulation, and language development by addressing oral motor challenges and using alternative communication methods when needed. Occupational therapy supports fine motor skills, self care tasks, such as dressing and feeding, and sensory processing. Behavior therapy focuses on development of adaptive behaviors, emotional regulations, and social interaction skills. Challenges in accessibility, availability of these services depends on the location, financial resources, healthcare infrastructure, with some families facing long waiting lists. Okay, the long waiting list issue is usually like in the US, there are long waiting lists for, especially for testing and things like that within the school system. Because in the United States, the public school system has to provide these services, say for testing, different kinds of assessments, the special education, whether they need to be what they called a confined classroom or mainstream education. So confined classroom is usually special education where they have 4 or 5 kids in there. Now, here, I actually, from what I've seen, and what the ministry has done here, I find that the waiting time is so much less here than if I compare it to back home. I find it a lot less. They go to the ministry, they go through whatever they need to do, go to wherever the ministry wants to go, and then finished. They get their contract for whichever special education services they need. So I find that good. The problem with accessibility is like the kids that are living in the villages. There are not that many centers, and especially kids that are English speaking. I think that is where the issue comes, because all the centers here now have to be Arabic speaking centers. They can't be English speaking centers. Some centers have some English speaking staff, but it's not enough for the amount of influx of English speaking students that I get. We get quite an influx of students and that are looking for rehabilitation centers. I'm usually sending them to CCR if they're on that side of town. But then, some of them that I send to something closer by, if they're nearby here, there's no English at all at those centers. So I find most of the accessibility comes in language. All of these services are available in Muscat, Salala, Sor, Sahar, Nezwa, Salala. They're all available, but most of them are in Arabic. So when you have people that need English services, these are the services that I find that are lacking here in our community.
Yes.
Anybody else? Dr. Sonia, Randolph, Sheila, Shema.
It's okay, Doctor.
For
Just us because it's a long time, little bit.
for us here in the Philippines, can you hear me?
Yeah, let me just mute her.
Okay. Okay. So for us here in the Philippines, the struggle really is more on the financial part because most of the kids are coming from families with who are financially challenged, and it's just so sad that the government uh, has not that much support for kids with needs. But because of the um, influx of non-government organizations who help these kids, that's how the gap is being mended now. So hopefully, and also the lack of that many centers because there are more influx of kids now that needs intervention more than the other years. There's much more influx of kids with needs right now, and especially those with Down syndrome. So
Yeah,
I guess
well,
the gap that needs to be fixed is the ratio of therapists and the students or the patients that come in. It's really a struggle. I guess anywhere we go, it's a struggle between on the ratio of the therapist and the kids who needs intervention.
well, I can say here the government does support the kids that have needs, and usually they're paying for these children to go for the centers. The parents, well, the citizens, they don't pay for kids that have disabilities that are in special education centers. They go to mainstream schools. Yes, they have to pay. The ministry doesn't pay for those. But within the special education centers, yeah, the government pays for these children. So I think here they have, they're doing well. I think the government has done well to support these kids.
Well, we're hoping that the same will happen here in our country, because there's really a lot of kids who really have needs and who really needs intervention. That's why most of the time I do give uh, workshops on how to help parents do the home therapy themselves if they don't have the capacity to do it, to send their kids to the therapy school.
Mm-hmm. Okay, that's great.
Thank you for
Dr.
doing that,
Sonia,
ma'am.
how
Coach.
about Indonesia? How
Um,
about Indonesia?
I think Indonesia similar to what Sheila experienced in Philippines, because of the financial issue, it's very difficult for the parents to access for the therapies. Even in because Indonesia is an archipelago, is an island. From island to island, it will be difficult to find the therapies if, except for the island where the capital is. So we have similar challenges in Indonesia like in Philippines. But I think good thing that in Philippines the NGO can collaborate with and can provide some service that the children need it, right? But in Indonesia, I think it has not been there is involvement of the NGO.
Okay. Okay, let's go to the next one. Where's this thing? Okay. What role do parents play in reinforcing therapy goals at home, and how can they be supported? Encourage consistent practice. Parents can reinforce therapy exercise daily through play routines and structured activities at home. Use recommended tools and strategies. Implementing visual supports, adaptive utensils, sensory friendly techniques can help children generalize skills learned in therapy. Maintain communication with a therapist. Regular updates and feedback from therapists allow parents to adjust home strategies and track progress effectively. Seek parental training and support groups, attend workshops, and access online resources and networks that can help parents gain confidence and to support their child development. This one, I think that we have pretty much talked about this one,
Mhm.
about how to support the parents with workshops
Yes.
and things like that. Is that, yeah, the parents need support on how to work with their children. Isra, she had to leave for a staff meeting, but Isra, she had explained different ways that we can support the children in or support the parents and how to teach their children. So we won't really talk about that because we've already covered that. Okay. So let me see what is this is okay, this is the main one that we want to talk about now. Transition into adulthood. How prepared are young adults with Down syndrome for life after they leave special education centers? Many lack training in independent living skills. Daily tasks such as cooking, cleaning, money management, transportation are often not fully taught, making independent living challenging. Vocational life skills should be prioritized to improve job readiness. Structured training and workshops, workplace behavior, task management, and professional communication help individuals transition into employment. Limited access to structured transition programs. Many young adults with Down syndrome leave school without a clear pathway to employment, further education, or community engagement. need for ongoing social and community interaction with integration. Without structured and social opportunities, young adults may struggle with isolation and have fewer choices to develop friendships or engage in social activities. Family often lack guidance on long term support options. Many parents are unsure how to navigate adult services, financial planning, and long term care for their child's future independence. Okay, when we talk, okay, everybody's still here, right? Okay. When we talk about independence, I mean, here, usually the child continues to, if a child with Down syndrome continues to live with the family, where back in the US, we have different kinds of programs. Some kids might live in group homes as they get older. They might get employment. Some kids also may do independent learning, where the parents get them an apartment nearby so they can learn how to live independent. I have never seen that happen here, but it happens quite often in the United States. Okay, talk, you guys.
Okay. The same struggle here in the Philippines. When they become young adults, there are less and less opportunities for them for employment. That's why it is I guess the basics that children and parents need to understand is to engage their kids into vocational courses, at least the basic vocational courses. And the limitation of that is if there are limited opportunities for them in the society, that's where the struggle and the challenges come in for them to learn independence. But what we can make the parents have awareness with is at least teach the child on the basic life skills like how to manage their money, like what you mentioned before, where you assign the bills to your son. That can be some of the basic skills that can be utilized by the parents even though they are not yet employed. That way they will also be mimicking the skills that are being adopted for those who have jobs when it comes to finances and when it comes to independence, making the right decisions.
Yeah, the problem is actually jobs. I think one of the problems, and I think the same problem goes in Asia and the Middle East and probably
Yes,
into Africa, is for people to hire people with Down syndrome. I think that is one of
exactly.
the major issues. I know one of the supermarkets, big supermarkets, Lulu, they do sometimes hire people with Down syndrome, but for basic jobs like for bagging groceries or for putting the food up on the shelf, service jobs. People with Down syndrome are capable of more than just service jobs if they have the right opportunities and the right education.
Yes, yes.
Yeah,
But the
yeah.
question
Randolph,
is,
you have anything to add? Shema?
That's actually the most common question that we are actually facing. What is the next after the rehabilitation, after all this stuff is given to them, as what Coach Sheila was mentioning a while ago. So it will go back to the very basic. I have to agree with Coach Sheila about that. That
Yeah,
parents, yeah, because after that, the kids or these people will really go back to their family after.
yeah,
And
yeah,
who will take care of them after? Well, their
yeah.
family.
Yeah, well, see, that is the reason that for the person with Down syndrome gaining that independence, learning how to live alone or with a carer, um, we we do have like communities within the United States where each person might have their own apartment, and there are carers to come in, assistive living, that's what they call it. We have those types of things. But then we also have those Down syndrome people that maybe live independently. Sometimes the parents build a little apartment off of, but next to their house, you know, in the same lot with their house, so they can check in with them. But for for these people, it's very important for them to learn the independence, even if they have a carer with them. But they need to gain some kind of independence, um, you know, to be able to work, to be, um, to be able to live their a life as adults. I'm going to unmute. Let me see. So, this is actually something that is important, that really isn't yet available here. The rehabilitation is only around 15 years here. So they haven't had all of that time to build up what happens next. What's the next step after they reach to adulthood? So, I'm sure that they are talking about it and investigating about it, what they can do. But like in the U.S., there's basically three. You have the group homes, and the buses take the kids, or they're not kids anymore, but the adults out to work locations. Then you have the assistive living things. And then you have independent living, where the person is living independently. So, the last one would be independent living with like a small house or a small apartment on the same property as their parents. So here, there's only one. The one is living with their parents. So they haven't got to that step yet. And I think eventually they will get to that step when they see, what the United States is doing, what UK is doing, what Germany is doing, these Western countries, how that they are supporting these kids. It's still going to take time. Oman is only 15 years in. So it still will take some time for them to get to that point about, okay, now we have adults. How are we going to train these adults? They do have a couple of adult training facilities to train vocational training, but there still needs to be work done, but they'll get to that point.
Yeah, exactly. But I think,
Another thing that can be, oh, sorry.
it's
Yes, you
okay,
can
ma'am.
go
It's
ahead,
okay.
sir.
It's okay. Coach. Go ahead, coach.
Okay. Another thing that uh, I I recommend to parents is to n- identify what is the strength of your child. Like for example, if your
Hmm.
child is into cooking, this how about developing them instead of employees into entrepreneurs? Because if there are
Yeah,
no
yeah,
opportunities given by the society, the family can open opportunities for their kids themselves. Because
exactly.
now,
You can.
especially
Yeah.
now that the online selling is booming, they can do that for their children. So I guess the gap that we need to to bridge for the parents and for the child is to also orient or open to the parents how to be more creative in focusing on the strength of the child and what the child
Hmm.
can do and how they can support that strength of the child so that the child can develop an entrepreneurship mindset or
Yes,
they can
right.
help support the child to open their own business because reality is there's limited or even to no opportunity for their children to be employed. So let us be the one to open that opportunity to our kids.
Right, right. I agree.
Yeah.
What were you going to say, Randolph?
Yeah, I agree also. Thank you for that, coach. Yeah. But I think, Doc, no, I remember one. Um, We have two kids before, like they're already adult with us. Remember,
Mm,
I know you remember them. And then we are actually encouraging the parents to bring them out from the center and enroll them in the vocational
mhm.
institution to may have vocational degree or something like that. But the parents are insisting, no, we cannot bring our kids to this because we don't trust them. Say like that. That kind of
See,
thinking.
you know, the one
Yeah,
thing the parents need to realize that they're not going to be here forever, and
that's
the
it.
child will have to
Parents
be
awareness.
able to do something, you know? So, that is the wrong kind of attitude is like, oh no, we
Mm,
don't trust them. The child is already big and
yeah.
already adults. And so they can go for these vocational. I've encouraged a lot of parents who had kids with disabilities, and those kids were very interested in computers, to take them to an institute and let them to learn more about the
Mm,
computers, you know,
yeah.
um, especially computer repair. That's a big thing. Everybody needs their computer repaired from time to time. And these types of kids are usually very good with their hands.
Yeah, exactly.
Okay, let's go to the next one. Uh, What employment? Okay, we just talked about this, so we'll skip this one. We just talked about that. We added that one. Okay. How can families and communities support independent living skills for children with Down syndrome?
Yeah.
Teach daily skills like money management, cooking, and transportation. Practice hands-on training, everyday tasks to build confidence and independence. Develop community-based support programs and independent living centers. This is what I was talking about. Provide
Mm,
structured environments where individuals can learn and practice life skills to prepare them for semi-independent or independent living. Encourage decision making and problem solving skills, allowing individuals to make choices about their schedules, meals, and daily activities. Promote social inclusion through community engagement, participation in recreational activities, volunteer programs, and local events help individuals with Down syndrome develop social connections. Okay, most of this is we've already talked about, but the
yeah.
semi-independent living and independent living, I think that is something that needs to be talked about more, because like I said, the parents won't be here forever
Mm,
to be able to help their child. So this is the independent living, transitioning into adulthood. This is something that is important.
yeah.
Okay, I'm going to go on.
Agree. Agree.
You agree? Okay, I'm going to go to the next one because we already talked about this mostly.
Yeah.
I think we're almost finished. Where is Shema?
I'm here,
We
Doc.
haven't heard. You're here. Are you sleeping? Okay, this
No,
is the
no.
last one. How can
Actually,
communities and businesses work together to improve inclusion and accessibility in people with Down syndrome? Encourage businesses to provide vocational training. Companies can offer structured job training, internships, and mentorships programs to help individuals with Down syndrome gain workplace skills. Improve accessibility in public spaces and businesses. Communities and businesses should ensure that stores, offices, and public areas are physically accessible with clear signage, ramps, and sensory-friendly environments. Increase public awareness and disability education. Community programs and businesses can host workshops, job fairs, and awareness campaigns. Development partnerships with business and local organizations. Business can collaborate with disability organizations to create inclusive hiring practice and provide ongoing workplace support. Expand community-based support programs. local businesses and local businesses can sponsor or participate in programs that offer social, recreational, and skill building opportunities for individuals with Down syndrome. Now, with this, I know the Disability Association is, oh, hold on, let me let Sheila back in. Okay. With this, I know the Disability Association has a list of people that want jobs. So they keep that list, and when someone has a job for a disabled person, then they will, send people for interviews. But there needs to be more than just one association trying to help people with disabilities to get jobs. I mean, job fairs is a good idea. I mean, job fairs for people with disabilities, collaborating with businesses that will hire people with disabilities. I remember that we were trying one time to collaborate with Sultan Center to help one guy to get a job. So there is lots of that. There's lots more work to do. But like I said, Oman is only 15 years in with these types of centers.
Yeah.
Yeah.
Any other ideas of helping people with disabilities or Down syndrome in trying to get, work?
Again,
I
we should uh, again we should encourage know how to encourage for the communities or the company who wants people adults with Down syndrome to work with them. Of course, they have to prepare hands-on training how to do the work, like because this
The
they
training
don't know
is
how
really,
to.
yeah, the training part
Yeah,
is really important because sometimes companies will hire a person and then they won't give him any training whatsoever. They just put them there. You know, the
yeah.
training part, there needs to be a 2-week training process at least.
Yeah, for normal people can be 2 weeks, but maybe for Down syndrome, maybe need more time, right? So they have to have patience in doing the job on training, and also we have to see also what is the strength of the kid. Not all kids can work in grocery shop, or all kids with down all young adult with Down syndrome can work use computer. We have to evaluate also what is the strength of each
Yeah,
young adult with Down syndrome.
Mhm.
yeah,
Yes.
there needs to be more testing and things on what suits that person, what kind of job will suit that person.
Another that we can also
Ye-
encourage are for the NGOs to participate, for the non-government agencies to also
Yeah,
participate in raising awareness and giving opportunities for kids with disabilities. And
yeah.
I'm happy to see that there are kids who are uh, there are NGOs
Your sound went out.
in raising awareness and adapting communities with kids with special with kids with disabilities, like they adapt a certain barangay here in the Philippines where they do medical missions for kids with disabilities. They give special awareness and workshops for the parents with disabilities for their way awareness, because hand in hand with the government and the non-government agencies, we can all help our kids. We just
Mhm.
need to really have confidence on each other and build programs where we can bridge the gap for those with special needs.
Mhm.
Yeah, yeah, yeah. Yeah, there's more work to be done, but I can say as far as here, I think they have they um, that we've come a long way than where we were 15 years ago. Dr. Sonia will remember where we were 15 years ago. But I would say services have improved. There needs to be more work with for adults, about job opportunities. Especially for those ones that can do jobs. I think there needs to be opportunities for Down syndrome kids that have the higher IQ to go onto the colleges and get a degree. So these are my opinions that if they have, like I said, if they have an 80 IQ, there's no reason that they can't go on to regular mainstream school and even college and earn a degree. So these are things that need to be discussed and put in place because not all kids with Down syndrome have a 60 or 50 IQ. There are, quite a few that I tested that have, almost a normal IQ level. So those kids should be able to go on to regular schools, go on to college, earn a degree, and work in their field. There's no reason that they shouldn't be able to, but more awareness needs to be put on this. We don't have enough awareness of these types of things for people with Down syndrome. Now, that is the main issue, that there's not enough awareness.
Six.
Is everybody there? Okay. On this, we are going to end it. Thanks, everybody. There are the other people they had to leave because one of them had an assessment. The other, Ahmed's internet will not work at all. And the Isra, she had staff meeting. So with this, we're going to end it and thank everybody that joined. And I'm so glad we did this. And Dr. Sandra Randolph Shema, we'll
Thank
have you
you.
back.
Thank
Thank you very
you.
much for
There's
this
All
more of
invitation
right.
this.
to be part of this.
Thank
There's more of
Okay.
you.
this in the future, Doc.
Huh?
Yes, more of this.
There's more of this in the future.
Of course.
All right.
All right. Bye,
Okay.
everybody.
Okay,
Thank you,
bye-bye.
Thank you.
everyone. Nice meeting
Bye.
you,
Bye.
Coach
Happy
Bye,
weekend.
Sheila.
everyone.
Yeah.
Happy weekend. Bye.
You too.
Nice
Happy
Bye
meeting you
weekend.
bye.
all.
Bye.
Bye.
How to